Good morning, everyone, and welcome to the Taos County Board of Commissioners special meeting for today, July 29th. For the record, it is 9:06 a.m. Madam Clerk, if you can continue with the roll call.
Commissioner Brown.
Present.
Vice Chair Sanchez.
Present.
Chairman Romero.
Present. Okay, thank you.
Commissioner Blanken.
Present.
Thank you very much. Commissioner Dudon is the only commissioner not available today. We will move on to the Pledge of Allegiance. We'll ask Mr. Brent Jaramillo to lead us with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, we'll move on to the approval of the agenda. Any changes from staff, commissioners?
Chairman.
Commissioner Sanchez?
Chairman, Commissioners, I'd like to amend the agenda. I've got a road up in my district that I would like to talk to the commission and also to our attorney, Bitter Creek Road.
Okay. We'll do that as item A under presentations.
Talk about it, but we can't act on it.
Mr. Chairman, Commissioners, just for your information, as you know, we've had some flooding in Taos County recently. I think Bitter Creek Road is one of those roads. The staff at Taos County are actually preparing an emergency resolution for the Commission to consider at the end of the meeting today.
Okay.
And I think at that time we could also have the discussion about Bitter Creek, if that's okay with Commissioner Sanchez. Thank you.
Mr. Archuleta, what roads is this going to include?
Right now, it's the Torres Road up in the Talpa area, and then Bitter Creek.
Okay.
And I think most of the commission is aware of what's happening on those roads, but if there's other roads that the commissioners have not told staff about or are aware of, we've had some pretty substantial rain in some of these areas and have been washing out and actually flooding some homes. And so staff has been working to mitigate that the best that we can. So we should have that resolution ready by the end of this meeting today, if possible.
Okay. And also, Mr. Archuleta, out in my district, in District 3, if we can find out if there have been any complaints about Ojo Caliente and Pilar, because those are two areas that have been receiving some major downpour as well.
Mr. Chairman, Commissioners, we have kept in contact with the Ojo Caliente area. That was an area that flooded last week. Most of the flooding has happened in the Rio Riba area, and but we're keeping a close eye on that also.
Okay, thank you very much.
Chairman.
Commissioner Barone.
Steve, if we could get just an update on, there was two bridges that had some really, a lot of concern. One of them was in Los Cordobas and the other one was down in Hondo. What has been done and or what is planned to be done? If we can just get an update. You don't have to do it in, I would just like to know.
Yes, sir.
Thank you.
Okay, any other changes to the agenda? If not, do I hear a motion for approval as amended?
So moved.
Second.
Okay, Madam Clerk?
Commissioner Blanken.
Yes.
Vice Chair Sanchez.
Yes.
Commissioner Brown.
Yes.
Chairman Romero.
Yes. Okay, we'll move on to citizen concerns, item 5. We'll listen to item 5A first. Commissioner Sanchez, Bitter Creek Road.
I think we'll just hold off on that with the manager just brought up earlier. We'll just
Okay.
put it all together.
Okay,
Thank you.
very good. And then is there anyone from the public that wishes to speak? Okay, go ahead and come forward, state your name for the record. And good morning.
Good morning, gentlemen. My name is Lisa O'Brien. I'm here today representing Los Jardineros Garden Club. I'm not part of the discussion on the agenda. I just wanted to let everyone know that we do have our 2014 garden and home tour is scheduled for this Saturday. I think typically the club has made a presentation to county commissioners around a lodger's tax funding, which we did not receive this year. But I just wanted to let everyone know that the club is having the tour this Saturday. I have one complimentary ticket for each of you. We have 5 amazing properties on the tour this year. And typically we have anywhere from 7 to to 800 people that are on enjoying that tour this weekend. So just wanted to let you know that that's happening. And the proceeds from the tour go directly back into community through our community grant making project. So we've supported gardens this year at the Taos Youth and Family Center. We have a youth vegetable garden at Taos Library. We're representing the Kaus Foundation and also the Harwood this year. So just wanted to let everyone know it's 9 to 4. Tickets are in your envelopes.
Awesome.
Thank you.
Thank you so much. And Lisa, you stated that you didn't receive any funding from the county this year. Is that the case, Ms. Martinez? There was a request, right? There wasn't a request submitted to the county?
There was not. And we'll probably pick up a conversation with the county clerk because we had some questions about notice on that.
Okay.
But that's a different conversation. Thank you.
And Chairman, I just want to applaud them. You know, they've done some beautiful work around the community, and it's great to see the work and great to see this program together. I mean, they've done some beautiful work, and thank you, Lisa, for
Thank you.
that.
Thank you, Lisa. Okay, anyone else? Go ahead and come forward and state your name for the record.
Good morning. My name is Carol Miller.
Good morning, Carol.
How are you?
Doing well.
25 years ago, hospital care in Taos faced a threat from an outside for-profit business entity. In 1989, a group of investors made it known that they planned to build a private for-profit hospital in Taos. The community rallied against this business plan. Hundreds of people attended public meetings for more than a year. When a new county commission took office in 1991, they committed to building a new public hospital for the people of Taos County and surrounding areas. Local 1199, the National Union of Hospital and Healthcare Employees, joined with medical providers and community members to work for a public hospital. I was hired as the Taos County Health Facilities Consultant in 1999 to develop a plan for the future Taos Regional Medical Center, a public hospital. The goal was to pass a bond to fund the construction and equipment. Public study sessions were held, and the architects and commissioners incorporated the public recommendations into the planning. A committee was formed which held community meetings around the county. As a result of this open and transparent process, voters passed a bond issue on September 24th, 1991. Why is this history relevant? Because the great accomplishment of building a new state-of-the-art rural regional medical center only happened when there was openness and transparency, the key building blocks of trust. Today, trust must be rebuilt with the community, and that will take open meetings and open books. There is no other way to regain the trust of community and staff. It is time for this public hospital to become truly public. The hospital does not need a for-profit management corporation to run it. It needs management dedicated to the community, not CEOs always looking for their next better step up the corporate ladder. First Brim, then Quorum were the corporate entities that Taos Health Systems chose to run the hospital, and we all know that the hospital has gotten into financial problems. Over the years, we've seen really bad management decisions made. I actually watched the former CEO stand at Piqueries Pueblo and lie to the tribal leadership and community, destroying a project the Pueblo had begun years earlier. Taos Health Systems defended the destructive behavior. There's no value to the community. It formed at a time when the healthcare system in Taos was quite chaotic, and it was seen then as a short-term solution and should have been dissolved when the public hospital opened. Today, it is a self-selected group serving no real purpose in a public hospital. The public of North Central New Mexico deserves better. It deserves the right to vote for the hospital board. Other counties in New Mexico have this right. They use several different models. The one I prefer that was presented to the county commission in the past is San Juan County, where nonprofit organizations in the county elect the board of the San Juan Regional Medical Center in Farmington, and they have been doing this since 1952. Another model is the special Residential Hospital District, where voters directly elect the board, similar to the way school districts operate. You are at a historic fork in the road. You can choose the well-worn path of delegating the leadership to others or forging a new and better path to a stronger healthcare system. Getting the hospital back on track with the community and staff will take open meetings, open books, and more community control. I trust the people, and I urge you to stand with us on making the public hospital in Taos one that truly belongs to the public. Thank you.
Thank you very much.
Do you have any questions? No, I'd be very happy to work with you if you have any questions about more detail and some of the decision process that was used in the past to build a public hospital. Thank you.
Thank you very much. Anyone else? Go ahead and come forward and state your name for the record. Go ahead and come forward. State your name for the record.
Hi, I'm Sally Blair. I have lived here in Arroyo Hondo for 38, 40 years and was a retired school teacher. And I'm very dedicated to this community. I will live my life out here in this community, and I'm very concerned about the hospital and what's going on right now. I really feel that the hospital needs to be looking at the well-being of us community members and not necessarily being run by CEOs who are interested in the monetary factor. I know the money is always the bottom line, but getting rid of nurses who have been in the hospital for years and years just because they have higher salaries and it's a better way of making decisions is not good for the community. And, you know, I think any of us who are growing old here in Taos look to that Taos hospital as being a lifeline for us in terms of our health and our well-being. And I would really like it to be a nonprofit organization that's here for us as community members and our needs, and rather than looking at just the straight monetary bottom line. Thank you. I appreciate your time and interest.
Thank you very much. Okay. Anyone else?
Good morning. My name is Trish Curran. I'm an ex-colleague of Miss Blair because she retired. I'm still an elementary physical education teacher with the Taos Municipal Schools. I'll be starting my 15th year with the schools. I've lived here since 1991. So like Miss Blair said, this is my community. I'm very invested here. I've lived and worked here for years. I'm a volunteer firefighter in Taos Canyon with Rio Fernando. And for that reason, for many reasons, I'm concerned about the state of affairs with the hospital also. This regards the statements that were made earlier by that lady with the glasses. I support what she said. I work at Enos Garcia. I teach upward of 500 students per week, 5 through 12-year-olds. And my understanding is that the pediatric services at the hospital are about to be suspended. This is as we enter into our school year. We start in just a couple of weeks, and I have very intimate knowledge of issues with our children. We have a lot of impoverished children in our schools, and I'm very concerned about the notion of them having available health care at the hospital. The burdens on the families financially to see their children seen at the hospital and then transferred out of the community to another place because there are no pediatric services, very concerning. The notion of having only 1 or 2 ICU beds in our hospital for serious injuries, again, very concerning. So I'm here to support the hospital and ask for you to try to take it in a different direction. Again, the quorum thing, to see a CEO making over $200,000 in a salary out of our small community hospital, it just seems unconscionable to me. So what they said, I support. And thank you very much for your time and attention to this matter. Thank you.
Thank you, Trish.
Hello, my name is Amanda Bissell. I'm from the greater Penasco area. And I think I would just, I don't want to, I had a lot planned and now I'm just going to keep it short because I think Carol really did a good job of covering it. But really what we're looking for is a quality, accessible hospital. And Holy Cross does have quality, but the access is the problem. Access isn't just the hours that you're open, it's whether or not you feel like you can go there because you're trusting. And the trust really does lie, it's with the administration, and that's where it starts. As a quick example, I think one way this commission could really work on this issue is the way that the board is put into place. Right now it's an appointed board rather than an elected board. Now I'm up here talking to an elected board, you're all looking at me, you're engaging with me. Unfortunately, every board meeting I've been to with Holy Cross Hospital, only the one board member that I know personally makes eye contact with me. Everybody else is down, avoiding, and that makes me feel like, where's the accountability? If I don't even feel like I'm being listened to, where's the accountability? So I think that's one thing this commission could really focus on is how do we have a board that's really representative of our county and our community that has our best interest at stake. And lastly, I think we're going to hear the word transparency over and over, and I think that could mean different things to different people. For me, transparency means that if I need information, that it's available. As simple as that. If I go to the hospital, if I go to the website, there's some information there. Maybe it's a summary and last quarter's financial statements. Nothing huge, but something. And right now, it's very hard to get information. And as you guys, I'm assuming, know in this community, even if you're not hiding something, if you are not forward, you're giving the perception that you are. And perception really goes a long way. And that goes back to trust, and that goes back to access. So I'm really excited that you all are interested in helping us form a quality, accessible hospital in our county, because that's truly what we need. Thank you.
Thank you very much. Anyone else? Mr. Thilke.
Thank you, Mr. Chair. I'm on a different subject. I was a little disturbed by an article I saw in the paper about speculation that Commissioner Mayor Baroni might resign his position and give it to Susanna to appoint. This could be a disaster. And she could reappoint a commissioner that's already been thrown out by the voters as one of the options. So I would like to encourage Commissioner Baroni to hang in there, and I'll hang in there with him. Thank you.
Thank you.
Okay, anyone else? Good morning, Jean.
Thank you. Yeah, I'm Jean Nichols from Llano, and thank you very much I wanted to thank you all for forming a task force, study group about the hospital. But I wonder if this group, I know it's been in effect since December, and I'm wondering what kind of teeth it has for actually doing something, action, having to do with the hospital. We kind of feel for years that that Quorum has hijacked our community hospital, and all the decisions are made behind closed doors. I understand recently that there's discussions about doing some kind of partnership or some kind of communication with UNM, but we haven't heard anything about it. We haven't been able to be part of that discussion. So once again, it's behind closed doors. My understanding is that the study group doesn't even know about this. So, I know it's I think the biggest problem the hospital has is trust. I know that some of us have personal issues why we don't trust to come to Holy Cross. I've heard from so many people that they won't go there as the first option, whether it's because they don't trust that the medical procedures that are going to be done to them are the best for their care instead of maybe the most money. It's become a money-driven thing, and that's not a good thing. then in Penasco, of course, we lost our trust because the hospital grant that was gotten put our spot office out of business. And I have a letter about that I'll give you so that you have the background information on that. But basically it's, the hospital kind of deals with it when it's a matter of trust. They think that's a PR problem, and there's all kinds of ads in the paper and ads on the radio. And if there was good patient care here in Taos, this is the only hospital, people would not go out of town. People would come to this hospital. We want it. We want there to be a hospital again that we're proud of and that we want to come to. And we appreciate your help in maybe bringing us back to that point. Thank you very much.
Thank you very much. Thank you. Okay, anyone else? If not, we'll go ahead and move on the agenda to... Okay, go ahead.
There are a lot of members of the staff that actually came in from the shift last night, and I just want to say thank you to them for showing up. A lot of them are tired and are going to have to go home now because they need to get rest for working again tonight. So,
state your name for the record, sir.
My name is Walter Brennan. I am one of the nurses in the hospital, and I also am one of the vice presidents of the union.
Okay.
So I just wanted to acknowledge their patience for coming out and listening and being part of the process. So.
Thank you, Walter. Okay, we'll move on then to item 6, actually. Presentations, discussion, financial update on Holy Cross Hospital, an implementation of Senate Bill 268, Taos Health Systems. Mr. Phillip Lowe, CEO, and Spencer Hamons, CEO. Good morning.
Commissioners, thank you for having me here today. Phillip could not be here. As you know, Phillip is our new interim CEO. He's in his 3rd week of getting his feet wet, so he was not able to be here today. So I came to talk about Senate Bill 268 and to talk about the implementation of the Centennial Care Waiver and how that's going to affect the hospital. What you have, I've given you a couple of different packets. One you'll see has some highlighted information on it. That is the safety net care pool information specifically from the Centennial Care Waiver. And what I want to clarify, by the way, I'm Spencer Hamons. I'm the Chief Operating Officer and the Chief Information Officer, and I'm not a quorum employee. So anybody who wants to ask that question, no, I do not work for quorum. Whenever you take a look at the safety net care pool information, there are 2 different aspects of how this funding is going to happen. And it's very important to realize that these are 2 different things that came out of 2 different venues. The safety net care pool, or also part of the Centennial Care Waiver, was something that came from the Human Services Department, and it was presented to the Centers for Medicare and Medicaid Services as a way for the state of New Mexico to receive money under what used to be considered the Sole Community Provider Program. The idea behind the Sole Community Provider Program is for hospitals like ours, where we are the only hospital in our area, where we have to take care of everybody who comes through the door. If you're in a larger city, a larger metro area, the burden of taking care of indigent patients, uncompensated care, and Medicaid, which pays less than cost, when you have the burden of those 3 low-paying or non-paying patient types being spread across 3, 4, or 5 different hospitals, it's more manageable to be able to accept that burden. In an area like ours, where we're the only hospital, everybody is going to come to our hospital, and we are expected to provide care to everyone who comes in the door. So under the safety net care pool, or the Sole Community Provider Program, there is a way, a method, that CMS reimburses hospitals for the uncompensated care, at least to some level of cost, to make that burden acceptable. What happened here in New Mexico, probably 2008, 2009, was that honestly, hospitals were gaming the system. Hospitals were sending money to the counties out of their own coffers. The counties were then forwarding that money on to the state, and then the feds were matching that money at about a 3.1 to 3.2 times rate. And it's not acceptable to do that. Under the state statutes, the counties have responsibility to cover indigent funding or care for indigent patients. Hospitals are not allowed to pay money to the counties, which then gets passed forward basically to improve a bottom line. It's just not the right thing to do. So there was a whistleblower lawsuit back in 2009, 2010 regarding this, and the state, working with CMS, said we can't move down the path that we've been going down. So that was the impetus for moving with the Centennial Care waiver. So HSD, without consulting with the counties, nor with consulting with the hospitals, came up with this waiver, sent that through Centers for Medicare and Medicaid, and they came up with the process of what is now the Safety Net Care Pool. The problem is that was never funded. They came up with the idea of how they were going to make it happen, but there was no way of funding this. Senate Bill 268 in the last legislative session is the venue for funding the Safety Net Care Pool or the Centennial Care waiver. The problem is that the two things are completely separate. One is legislative, one is administrative, and Senate Bill 268 doesn't cover the funding requirements for the entirety of the Centennial Care waiver. Centennial Care waiver goes all the way up to 2018. Senate Bill 268 really only covers the next year and a half of funding. So what we are looking at is a problem in how hospitals are going to receive these payments. In the past, hospitals received quarterly payments for a portion of their indigent care funding. Now we're looking at the funding being one time a year. The formulas were up in the air. As Commissioner Blankenhorn knows, we've been talking about this since December of not knowing how much we were going to receive through the Centennial Care program. We just received information on Friday, and we are expecting to see a wire transfer either today or tomorrow that the amount that we're going to receive is going to be $5.1 million. We knew that that rate could be anywhere from $4.2 to $7.1 million. We weren't sure where it was going to be. We did find out, like I said, on Friday, it's going to be $5.1 million. We do have approximately $9.8 million of uncompensated care that we provide each year. So there is a bit of a gap in there. We are working with the state. There are going to be some improvements in Medicaid rates that we receive whenever we provide care to Medicaid patients. And we are also working to renegotiate some of our contracts with our commercial payers to improve those rates as well. I know that the question has come up, and this is one of the things I was asked to speak about, is what does the hospital feel Senate Bill 268 provides? And I think for Taos County, we do pretty well. If we look at what we did in the past, the county put in $1.3 million, and whenever that was matched, we received $5.2 million in base payments, and then a little less than $2.1 million in supplemental payments. The way with Senate Bill 268, the county will put forward $457,000, significantly less than the $1.3 million that was put in previously. We will receive $5.2 million in the uncompensated care payments. $5.1 million is 5.15, somewhere in there, which is slightly less, but still a much better return on the investment than what was in there before. We are expecting somewhere around 1.8, 1.9 million in improvements in our Medicaid rates this year. So we do expect to see quite a bit of return on the money that Taos County puts in. Now, the reason that Senate Bill 268 is such a huge issue across the state is there are two counties in particular that are struggling with this, and that is San Juan County and Lee County. These counties have huge, the oil boom is hitting those counties huge right now, and they are receiving much less than the 1.3 million that, or the 1 to 3 match that we had traditionally seen at the counties. If you look at Taos County, we almost go to a 1 to 9 match. You know, we always get 9 times what we're looking at. Whereas in some of those counties, it's a 1 to 1 match. They're not getting hardly any federal funding coming back for their programs there. And the idea being those are larger facilities. They have larger commercial payer bases, and therefore they have the ability to make up the loss with their commercial patients and other business units. And if you look through the Centennial Care waiver, again, this is the administrative piece that HSD gave to CMS. This is not the legislative piece. It is really geared towards making sure that the state funding, the county funding goes to the hospitals that are smaller, typically under 30 beds, because those are the hospitals that have the least potential to recoup revenue through other vectors. So those were the things that I wanted to discuss and answer any questions that you may have about the Senate bill and any other questions you may have in general.
Mr. Archuleta.
Mr. Chairman, Commission, Taos County staff will also be presenting that later on today. Also reference the 1/8 or the 3/8 that Taos County has, and then how the Commission wishes to choose that. We did bring forward also the possibility of paying the additional $288,000 that would be given to the state in order to get the third and fourth quarter of that match. The one question I did have for Spencer was, reference the $9.1 million of uncompensated care that you say you have. Is that at what rate, Medicaid rate, or is that at full rate?
That's at full rate.
Full rate. So really the sole community provider net pool is for Medicaid rate. So in reality, the hospital is getting reimbursed at that proper rate.
There is a slight loss, and part of the waiver is that you cannot make money on this. It cannot be a profit center. You cannot receive more money than exceeds your actual cost on this.
Correct. So I just wanted to clarify that for the Commission, that 9.1 million is at full rate. The sole community provider rate is at the Medicaid rate.
Now, Mr. Archuleta, you mentioned under Senate Bill 268, the county gives to the hospital, to the state, $457,000, but you also mentioned an additional $268.
Mr. Chairman, Commissioners, last year Taos County actually proposed giving the hospital $1.5 million so that we could get the 3-to-1 match. We did make payments in the excess of $600,000 for that. The third and fourth quarter is something that we're going to be talking with the Commission about today, whether or not we're going to pay that additional third and fourth quarter. House Bill 268 did not take into consideration the third and fourth quarter for this year, and because of that, it's not in the law as to what we want to do. We have received a letter from HSD asking us to pay the half of the 1/12 that we will be paying for the next year so that we can continue the payments, and so that'll be presented by Ms. Jaramillo later on today as part of an agenda item.
Okay. Any other questions? Tom?
Thank you, Chairman. Let's see, the 9 million, no, the 5.1 million is the one portion of the compensation, and then the 1.9 that you mentioned for Medicaid rates, is that in addition to that, so that it's?
That is additional funding that's going to, if our volumes were to stay steady, that is an estimate of, with the new pay scale for the Medicaid, that's where we would end up.
So the total compensation under the new bill will be approximately $7 million?
About $7 million, again, if our Medicaid stays solid where it is now.
All things equal. And during the years that the hospital and other hospitals were gaming the system, what was the maximum contribution during those years?
From my recollection, the maximum that the hospital ever received was close to $9 million.
Right, that's what I thought. And then it went, and then after the waiver, it went from 9 to 2.
Correct.
Like that.
Correct. And that is really what's gotten us into the financial difficulties that we're in now, is to take $7 million out of your compensation.
And when you talk about that 9-to-1 ratio that we're now enjoying, it's actually more than that, isn't it? A 1/12 is something like $600,000, and you're looking at $7 million.
If you add the Medicaid rates into that, yes, it goes up.
But you have to add the Medicaid rates to make it the same as during the gaming years, right?
Because there is no more supplemental fund.
Right. So the $9 million is now $7 million, basically.
Yes.
The $9 million during the best of years is now $7.
Yes.
Which is beyond any of our original hopes when this started. So I'm very glad that that's the case, and I've always thought that bill was just wonderful for Taos County. Our gross receipts that we have to contribute is much lower than it was last year, and the compensation to the hospital is much higher. So hats off to our legislators or whoever is responsible.
And sitting at that 1/12, the concern that I have is there are a few counties that have asked if they can contribute more than the 1/12. My concern on that for those counties who are out there looking to do that is I don't know that would get matched. What I think that would actually do is, under the Senate bill as it is now, the state has to put in some money from the general fund. And I think that what would realistically happen is that the state would not take as much out of their own general fund and put in there, because we would hit the federal max.
Yeah, and that's a relevant question to us later this afternoon when we consider what to do with that third 1/8, because that may not be the best way to spend our money, giving it to the hospital. In fact, your losses, you know, if everything goes well, your losses could be covered by this
Correct.
legislation. And then, since you're not allowed to make money on it, additional contributions from the county would be not useful.
Correct.
Well, thank you. Thank you for your presentation.
Yes, sir.
Just for clarification purposes, Spencer, how much has actually been received for the first quarter from?
Nothing has actually been put into our account yet. We will expect a wire transfer of we received an interim payment.
Okay.
We requested a special interim payment from the state of $1.4 million because we were having trouble even paying our vendors. Okay. We did receive that as an interim payment. That interim payment of $1.4 million comes off of the total 5.1 that we are receiving. So we were expecting to receive a wire transfer of the balance, the 3.9 or whatever it is, expecting to receive that sometime this week, but we have not seen that yet.
Thank you.
Okay, Chairman. Just curious, one of the ladies came up and spoke earlier, and they talked about the closing of the pediatric ward or portion of that. You wanna?
So we don't have, we do not employ any pediatricians at the hospital. So traditionally, the way that hospitals have traditionally worked, and this has changed somewhat in about the last 5 to 7 years, is that physicians are typically independent contractors. And they come to the hospital to serve inpatients, and we may pay a amount of money for them to be on call or to come in and take care of patients whenever that happens. And there's 2 different types of billing. There's professional fee billing and facility fee billing. And typically what has happened is that hospitals bill the facility fee. The provider, under their own provider number, they bill the provider fee. And that's how the provider gets compensated for the care that they provide in the hospital. The facility gets the facility fee, which is how we get the compensation back to the hospital side. We've seen a shift in about the last 5 to 7 years of more states allowing physicians to be employees. For example, the hospitalist program at the hospital, those physicians are actually employees of the hospital. We have a few surgeons that are employees of the hospital, and they actually receive a salary that we pay just as we would any other employee. And in those cases, we bill the professional fee and the facility fee both. Pediatrics is not one of those areas that we have employed the physicians. We do not have anybody on our payroll who is a pediatrician. Dr. Villarreal has given notice that she does no longer want to take call, and we paid Dr. Villarreal's office a stipend each month to cover inpatient and newborn call, so that she would come in the hospital if we had a newborn or if we had an emergency in our ED. And she has given notice back about a month ago that she did not want to cover call anymore for personal reasons. So what that puts the hospital in the position of is, how do we cover call? We need to have somebody on call for pediatric patients. And so we are working with UNM, we are working with a couple of locums providers who provide temporary physicians to be able to provide that coverage.
And another thing that I just want to cover, and I'm not picking on anybody, just so you know, in the past, the way our hospital used to be run, I guess we weren't outsourcing a lot of our employees or outsourcing a lot of our doctors or any of the administrative. So basically, we were independent. Everybody was independent. Everybody just worked, and that's how they got paid. Now we're outsourcing a lot of the care that we're having, and what I see is we have managers managing managers. You have a manager managing the manager of a certain portion of the hospital. Is that?
Well, if I've been here 2.5 years, but I had a relationship with Keene, who was the previous CEO whenever I used to live up in Antonito and La Jera, and I was working at the hospital in Alamosa at the time. And even Keene worked for QHR, so you know the whole QHR management contract is not anything new. I'm not sure how long that's been going on, but at least, you know, probably 10, 12 years at the very least. The move towards employing physicians, like I was talking about before, it makes things more difficult to manage, to be honest with you. Physicians traditionally have been independent contractors, and honestly, they've never been taught how to be an employee. And it's something that I don't think hospitals do a very good job of, is to say, you know, as an employee, you're going to have a new set of responsibilities, and you're not going to be completely independent in the things that you do, and we need you to comply with certain rules and regulations. And so I think a lot of the concern has come with the outsourcing of the hospitalist group to Apogee. I know that that's been a hot topic of conversation. And I think a lot of that does go back to the fact that that whole program was somewhat piecemealed over time. That program started years ago with, again, when you had independent physicians across the community that would care for you. So if Stephen came into the hospital, his family practitioner would come to the hospital and he would see you and he would determine your plan of care. Many years ago, the idea became, if you had doctors who were specialized in hospital medicine and how we take care of patients in the hospital, those docs, you would see better outcomes for your patients. Your patients would stay in the hospital less time. And so here at Holy Cross, we started the program slowly with hospitalists covering weekends at first. Then that expanded to hospitalists covering at nights so that the family practitioners didn't have to come in all night long. And eventually that expanded into hospitalists covering during the work week. And so that program expanded over time, and we did see better outcomes. I mean, if you look at our HCAP scores, our core measures, we're some of the best in the state. And so you do receive excellent care, and our clinical staff does a great job with that. From a management side, when you have a program that was put in piecemeal like this, it's very difficult to say, all right, we are going to set down some new rules. We have some new things that are coming out from the feds that we have to follow, and we have some best practices across the industry that say we want to be sure to get our discharges out of the hospital by 10 a.m., and we want to put that down as a metric that we measure you on. We want to make sure that certain billing procedures are done in a certain way because that's a metric we want to measure you on. And we did not have, and we right now are just now beginning to get the formation of a good management structure to be able to assure that these hospitalists who were traditionally independent contractors comply with those requirements. And that was one of the reasons for looking to outsource to Apogee as the management firm. We will still have local physicians. Our physicians will be here in the community, and they will be members of our community, serving our community. But what we are looking at is the management of that and the practices that have been developed over years coming from their corporate office and saying, these are the things that we've seen in our 300 hospitals that work for hospitalist groups. These are the things that help you to be more efficient. These are the things that help you to move patients in and out. These are the things that assure you have the best outcomes possible. And it allows us to hold that vendor responsible for doing that.
Thank you. Mr. Chairman, Commissioner Spencer, you touched on contractors.
Yes, sir.
Do we get GRTs out of that from the contractors?
What we have tried to do in many cases is, you know, if I can personally on the contracts that I work with, if I can make sure that that vendor has a local presence with their business license, that's how I want to get those GRTs out of there. We do have stipulations in our contracts to assure that GRTs are collected. I think that we could do a better job of making sure that those GRTs come back to Taos County.
Thank you, Spencer.
Yes, sir.
Okay. Thank you. Spencer, on the pediatrics, the woman from the school who spoke, how is that gap going to be filled? And how soon are you going to be able to have somebody to be on call?
Well, we have some conversations with UNM going right now, and I know that that topic came up earlier, and I would like to just very quickly address the thing about transparency with UNM. We have had conversations going with UNM about these types of issues, and can we work with with UNM to provide coverage when we need it. However, in order to get UNM to engage with us, we were under a non-disclosure agreement just to be able to have those conversations. So that is the reason we have not had those in the open. And that was a requirement of those conversations. The strategic planning group at UNM is working with us to provide some neonatal nurse practitioner coverage. We have talked to a number of groups that, especially the Rocky Mountain Pediatric group up in Colorado, which we're struggling with some of the things that this group has said, which is that specifically in most rural hospitals, you're not seeing pediatricians, and in some cases, you're not even seeing OBs take care of the newborns. You're seeing family practitioners do this. We don't think that that's a good idea for our community, and so that's why we've structured our conversations with UNM to say we need to have neonatal specialized nurse practitioners to be able to take care of that pediatric call, and we do want to work with our few pediatricians that we have in town. We do have a small number of pediatricians to work with them to see if they are willing to accept call, and we will, of course, be willing to pay for that.
And are you having communications with the school district?
We have not had the communications with the school district. We have really been focusing. Dr. Villarreal gave us 30 days notice on her intentions to no longer take call, and so we've spent the last 30 days rushing to get that done.
On the hospitalist program, you acknowledge that having the 5 hospitalist doctors at Holy Cross improved care. Why do you expect that going from 5 to 2 with Apogee is going to be able to provide similar care?
We're going to be using nurse practitioners to cover those night shifts, and we think that the processes that Apogee is bringing that standardize the way that everybody takes care of their documentation and all of those ancillary requirements that go outside of patient care, we think that that's going to improve efficiencies over and above what we've been able to do internally.
And if it doesn't work, how soon can you get out of your contract with Apogee?
If we have a non-performance, if we have a performance issue in that contract, then that is a for-cause termination of that contract.
Or you're just not satisfied with the care, not a particular default, but if you're not satisfied with...
If we're not satisfied, that would be under a different aspect of the contract, so we would be able to exit that under a no-fault portion of the contract. But if we, personally, I would rather have objective measures and say these are the things that you did not meet or we did not meet on either side of the contract.
And how's the CEO search going? This is last question, by the way.
Honestly, I don't know. That is, we are not handling that internally, so I don't have any insight to that.
That's strictly in the board?
Yes, sir.
And do you have any idea if there's been any consideration of considering candidates who are not part of quorum?
I hope so, because I'm one of them. I put my name in the hat. I'll be, for full disclosure, I put my name in the hat, and I do hope that it is considered. So.
All right. Well, good luck to you. Thank you.
Mr. Chairman, Commissioners, Spencer, are any jobs leaving our area from the hospital?
Trying to think, I cannot think of a single job that has, where we have taken a position and moved that job out to another location outside of our county.
Thank you.
Okay. Good.
Thank you very much.
Yes, sir.
We'll move on to item B. Discussion.
I'm not on the list. Perhaps you'd like to talk to us. My name is Doug Olipera. My wife, Dr. Diva Olipera, is a pediatrician whose term was up, who resigned, and who left Dr. V's practice here this past Friday. Perhaps there's some questions you want to ask her. We wanted to make her available to you today.
Okay, commissioners?
Sure, I'd love to hear from her. I don't know that.
Okay.
We're good?
Go ahead and come forward.
Pardon me?
Your wife, you said, is here?
Oh, yeah.
Okay.
Come on up.
Go ahead and come forward. Good morning, and state your name for the record.
You have to state your name for the record.
I'm Diva Olipera.
Olipera.
Okay, thank you. Okay. Commissioner Brony?
You know, this I guess, issue has come up is that we don't have anybody to fill those positions. You want to shed any light on that for us, or?
Well, they've been talking to us since she resigned. They want her to come back in an interim fashion and work the next 3 weeks until she takes her next job in Laramie, Wyoming. They want her to be on call during the days, and there would be no clinic, obviously, because she's resigned from there. But then
what was the reason that you resigned?
we weren't paid either for signing bonus from 2 years and moving expenses. Incidentally, we weren't paid either for her on-call nights and on the weekends.
Dr. Reeve would get, clinic would get that.
Right. The clinic took responsibility with that, and we're not complaining about that. That's the agreement we had. And so part of the workload was the clinic, 5 days a week, 8 hours a day, and any on-call duty. And of course, they went from 4 pediatricians down to 2. Now I guess they're down to 1. And so it became a 1 in 4 call to a 1 in 2 call. That was excessive, but you know, we're still happy to be here. And we didn't want to leave. That wasn't up to us.
And this was a contract that you had with a hospital, a contract that you had with a clinic?
Well,
I guess
unfortunately, we had a contract with the clinic. We should have had a contract with the clinic and the hospital. Cover their part of the arrangement with us. And going forward, we can only speak about what your situation is, what was in the past. Obviously, we're leaving the community now, and we can't, address your future. But we wish you well. Sorry, we're leaving. It was important for us to show up today.
Thank you very much. Really appreciate the conversation that you've allowed. We'll go ahead and move on to item B. This is a discussion, our community, local officials, say in our hospital, union representatives from local number 1199. Welcome. Good morning.
Thank you. Good morning, Mr. Chairman, Mr. Mayor, Commissioners. Thank you so much for including us in this meeting, and thank you to the County Manager's Office for allowing us the opportunity to take part of their business meeting and share with you this morning. Just waiting for the PowerPoint too.
Now, we do have a PowerPoint that was given to us as well. Is it this one?
Yes.
Okay.
Yes, and for the record, my name is Martha Jaramillo. I'm the secretary of the nursing side of 1199 Taos, which is our local hospital union. And
I'm Dr. Gina O'Hara. I'm one of the clinical pharmacists at the hospital.
And I'm Walter Brennan. As stated earlier, I'm one of the vice presidents of the union 1199 at the hospital.
okay, ready?
Welcome.
So last year at this time, we had 8 dedicated, long-term, community-based physicians at our hospital that were there to serve our patients 24/7 to ensure that all of the patient care needs were met so that our other local doctors did not have to come to the hospital in the middle of the night and different times. As of today, we have 1. In May at the board meeting, we had 19 physicians and other upper-level providers speak to the board. We had over 50 people packed in the little boardroom, and some of the physicians who resigned said they did so because they had grave concerns with what was happening with administration at the hospital, and they felt like they could not support or work for the organization any longer. Some of the other physicians were forced to resign when we signed the contract with Apogee, and they told us they were only hiring 2 physicians, and the others would have to find basically another job. These are people, since the 10 years that I've been at the hospital, we have seen almost the same group of physicians with a few additions that have been here 6 or 7 or 8 years at least, running the hospitalist program, taking care of our patients. We have an excellent working relationship. We have a great workflow. They used to come in the morning, every morning, to the ICU where I work to see the patients first. Then they said, no, we need to follow the rules. We do have a set of rules to follow, and we're going to go out and see the discharges first to get those people home and out of the hospital and improve the workflow. And all of their core measures, which are things we measure that we're required to do to get paid correctly, we're at 100%. We have someone who tracks that. They're doing everything they needed to do, and now we're down to 1. The other thing that extremely concerns us is an outsourcing of all of our positions. Now, although we don't have people physically working in other states or working in other places, we have management companies who are out of state. We have laundry being done in Santa Fe. Rather than repair our boilers, we were given as a union a cost-benefit analysis at one of our meetings, and they told us it would cost the same to fix the boilers or to send the laundry to Santa Fe. So now we've got someone, I'm not even sure who it is, doing our laundry and bringing it up a couple times a week. The other thing that's very concerning is last fall we had massive layoffs throughout the hospital, and that really ripped apart a lot of our departments and caused a lot of restructuring. And what actually happened is at the board meeting on August 28th, before we found out about the layoffs, we presented a plan that here's something we can do to help the hospital, to save money, to try to make things work. We gave it to the board, and the response from the board was, well, we're on a ship, there's a giant hole in the ship, we got to do something to plug the hole. And so basically what we wanted went unheard. All right. So over the past 2 years, not only have we lost physicians, we've lost nurses and other support staff, and we have lost 150 to 200 years of accrued nursing experience. During the time of the layoff, some people that have been at the hospital over 30 years were asked to retire, or they could bump a younger nurse and take their job and have someone with small children and a family be out of the hospital. And most of them chose not to do that and said, okay, if you're going to force me to retire, then that's what I'll do. And we can't get back all that knowledge and experience and education at the hospital, never mind people who have been at the hospital and worked other places, as I have, as many of us have, and have cumulative. I have 30 years myself in nursing, not as a nurse, but you can't replace that kind of experience. And through the last year, we've seen major changes at the hospital. And for us as a union, we've still seen a strong resistance from hospital administration, managers, and the board to involve us and the community in major decisions that affect the policies and what happens at the hospital. And that's really what we're asking for, is we want to be involved. I am not saying I want to go out and pick the new CEO. I have no idea how to pick a CEO. I don't know the first thing about the process for doing that. What I do know is that I live here, I'm from here, I married a local from Cuesta, I've been here 10 years, and now I'm related to everybody in Taos County, and they all call me Prima. And I take care of many of my friends, neighbors, and relatives through my husband. And I know what I feel the community needs. Other community members who are concerned know what they feel we need as a community. And so we would like to have an input and a say in what happens. We have been working with management. Every month we have a monthly labor management meeting. And our goal is to improve our working together, our communications, and our efforts to keep the hospital strong and vibrant. And it was a few months ago at our meeting, I said we would like to have more inclusiveness and openness from you guys when you're going to make major decisions. Not that we have to tell you what to do, because we shouldn't be telling everybody what to do, but that we need to have a voice in these decisions. And I said, if you had come to us and said, we're going to need to do layoffs. We're going to need to outsource the physicians, these things. Maybe more heads could have come together and figured out a solution that could have benefited everybody. And the response I got at the meeting was, well, we can't do that. We can't tell you when we're going to have layoffs. We can't tell you when major changes are coming because we don't trust you. And that's very disheartening to me, to work for an organization that tells me they're ashamed of me and they don't trust me and they feel like I can't have a part in my own hospital. And I love the people that I work with and I love the community that I serve, and I want to be able to keep doing that for a long time. We really feel that this is our community hospital, and we want to work together with you as the County Commission, with concerned community members, with everyone in the Greater Taos area to keep the hospital safe and strong and healthy for years to come.
Thank you, Martha.
Next slide. So after almost a year, we were here discussing, it seems like the same kinds of problems and our concerns about the ICU. Why are we still here and why are we still having problems? To me, that seems like a very valid question that you might have. Last May, Martha, myself, and a few others were called into what I like to say the principal's office, which was Peter Hofstadter's office, and to have a discussion. And what I feel like was to be scolded by our administrators for doing just this and having a discussion and trying to get the community involved and have a say in the hospital. I was asked why I didn't come to them first. I did. I have been active in trying to have a voice for the staff and myself, and have gone to these labor management meetings to voice those concerns, been present, and politely, I feel, dismissed from the hospital board meetings when they go into executive session. So we have tried to go through all the channels before coming here and making things more public. I truly do believe that having community involvement and having transparency and having the community truly have a voice in the direction of their hospital and services, not just hospital services, but just public services in general, make things stronger. That's what makes our country stronger, is that we have those voices and those rights. I was asked by Mr. Hofstadter at this May principal office meeting why I couldn't get over the ICU and the closing of the beds and move forward in a positive manner. I said, I'm trying. The problem being is that it continues to happen. What continues to happen? We keep having this trend of losing services. Right after April, this meeting happened, we are trying to transition losing our hospitalists. We had, about 2 years ago, we had 10 hospitalists. Again, now we have one of those hospitals who will remain and signed on with Apogee. Our teams, our membership of clinical services has changed so dramatically that someone who embraces change like myself, I can't keep up with it. I don't know what to expect from day to day when I walk in, and what services, what things I have to fill gaps of and holes, when I might be on call, who I need to support, what their knowledge base is, what it's not, etc. That's disheartening, and it's hard for me to keep a positive face to the community, though I believe in our hospital and I do believe in our team still. When we were discussing at one of the task force meetings the loss of the hospitalist and the move to Apogee, it was one of the people present alluded that this was normal attrition, and one of the members, Mr. Plummer, of the task force, said, no, this isn't signs of a healthy organization when you have over 90% of your service quit. That reminded me then at that point of about a year before, we had 3.5 surgeons, and 3 of those 3.5 surgeons, all but Dr. Citrullo, resigned of May of a year before that. So these trends continue to happen. And then losing our pediatric services, and having inpatient pediatric services being present as of August, that was the next trend, and I hope that that won't happen and that we can fill that gap and provide those services.
What has been the most common reason for all of the doctors resigning?
My understanding from them as friends and having heartfelt discussions was that they couldn't support an administration that was basically going after its staff and how they were treating their staff. There are discussions and side innuendos and rumors that once somebody shows or voices a concern or challenges a decision that might be going forward, they start getting targeted. There was one situation where I know of a nurse that I got involved with because there was possible discipline that was going to happen, which she made a statement to Mr. Hofstetter, and then all of a sudden, within a couple of weeks, there was a disciplinary action against her about not having the right attitude and her behavior. So are those feelings of hostility and being pointed out and stuff real? Yeah, they are very real. It's difficult for those people to make and stand up and say something when they know that they might be then looked and targeted. Maybe randomly drug tested, various other things alluded to that they're misbehaving somehow because they are asking questions. The decisions and the things in which, like UNM, et cetera, seem to still be exclusive and reactionary. And this, again, I don't feel is healthy. I do understand that there are times in which we have contracts or agreements with people in which we have to have moments or we can't communicate that to the staff at large, but this should be rare. They shouldn't be a common everyday event. We members of the Taos County need to be all hands on deck, and this is going from a quote with Mr. Burnham, in which last fall he said that there was a hole in the ship that they needed to fix. And I believe that we need, as Taos County, need to repair that ship and also be included in the course and the direction of that ship takes. Thank you for your time.
Thank you very much.
So first I'm going to address a question that was handed to me by, I don't know, Lloyd Lopez. The question was, what do you mean by outsourcing and how is that done and by whom? I want to speak to a couple of different things. One was brought up about the laundry and being outsourced to Santa Fe. I actually challenged the numbers that were presented to us in the first meeting, labor management meeting, and I asked some of those questions when I went back and I went through the numbers and I said, these don't really look right. I got a response on some of them. Yeah, I kind of saw that didn't look really right, but nothing went further than that. It was just, oh yeah, I thought it might be not the right number. So who's looking at the numbers right? Who's looking really in-depthly at these numbers? And I sat down with the maintenance director, and we kind of went through the numbers, but we kept finding that we really needed to sit down for a longer period, and we just have not had that chance to look at those numbers. But it always kept looking like it really was actually costing us money to send the laundry to Santa Fe. We actually would save over the long run the money that it would cost to buy those boilers and keep the job here. They say no, there's no outsourcing. There are people that were lost that are not taking care of the laundry in the hospital. The people who would actually be washing and drying that stuff. There are people who still bring it from the truck up to the hospital or from where the laundry's brought in from the truck. But there is a job that was lost. Talking about apogee, you're hiring people. There's 2 doctors that are still from this community. 4 of those other ones are not from this community. Those people are not paying taxes here. They're from other communities. They may come here for the days that they have to cover. They might, rent a hotel room, and then they'll leave and go back to where they live. So those are jobs that are being outsourced. If you ask what outsourcing means, those are the kind of things that we talk about. We have a wound care specialist that was left. She was a nurse practitioner. She went and now works in El Rito rather than working at the hospital because of the fact that she was challenged on an issue of a particular patient, and the only reason she left was she had 4 questions because they did not follow the proper procedure in looking at the complaint that was filed. And because they were not willing to answer those 4 questions, she said, you know what, I'm going to have to go somewhere else. If they had answered those 4 questions, she would have been comfortable with staying at the hospital, but she resigned instead. And we decided, oh, well, let's bring somebody else, a dermatologist, in from someplace else, rather than somebody who is a member of this community.
What were her questions?
I don't have those with me, so I apologize. And she's working today, so she wasn't able to attend. I can get those for you and send you an email about them if you would like.
To our manager.
Okay. So does that address what you were asking? Okay. Cool. So as we've been speaking to, is the lack of transparency in discussion, in the way things are presented to people. There's a picture that is not a fully inclusive type picture. It doesn't give all sides of what's going on. And we feel that both the administration and the board are part of the issue in terms of these lack of transparency issues and lack of inclusiveness of both ourselves as workers at the hospital who provide the direct care to the patients, but also the community members who demand that they be involved as well. We have 650 signatures on a petition that we handed around of community members who feel that they need to be involved. They need a hospital that they can trust. And the only way that can be done is by them being included in this discussion, in this process.
Thank you, Walter.
Yeah.
Mr. Chairman, I have just a couple of questions real quick. Are there any board members here today? Just see if any of them wanted to respond to some of the... Mr. Board Member?
There is one individual. Up. Go ahead and come forward and state your name for the record. Thank you.
I'm Michael Bone. I'm the Director of Physician Practices for Holy Cross. And I wanted to, I was involved in the whole discussions with the surgeons leaving. And so I wanted to correct, I guess, something that one of my colleagues said. Peter Hofstetter and I met with the surgeons for weeks. We had ongoing meetings. We were at these meetings till 9 and 10 o'clock at night, listening to them, working with them, and we thought we had reached an agreement with them. And I got a call the next day that they had decided to resign en masse, which was a shock to all of us because we thought these discussions were going well. You know, you can't get inside somebody's head and know their reasons for doing something, but it wasn't for lack of trying and wanting to meet these people halfway. I would also point out with the hospitalists that administration went to them and said, you all take the program over, you run it, this is what we need you to do. And they came back and said, basically, we can't do that. And they resigned. And we were left without hospitalist coverage with those resignations. Our choice was to try to recruit one by one or to go to a firm that could bring us in the people to cover these shifts. I can say that in all of those times, administration did meet with them, did listen, and we did have discussions. It's unfortunate when people resign and leave. And you can't get in somebody's head and figure out their reasons, but I was present at those meetings till 9, 10, 11 o'clock one night, meeting with these people, listening to them. And I think there's a common misconception. You know, you can't always do what people want, and I think a lot of times if you don't do what people want, they think you're not listening to them, and you're not hearing them, and you're not taking them seriously. So that's what I had to say. Thank you.
Thank you.
Just a quick, I respect that you can't get into people's heads. In the packet that we gave you, there is a letter from the surgeons that does speak to why they resigned and that situation. And I won't speak for the hospitalist. I am not one of them, and I wasn't privy to all those discussions. However, I was present when they were at the board meeting and saying that the reasons for their resignation was the way the staff was being treated and not wanting to be part of an institution that would treat their staff that way.
Okay. Now, in this packet that you handed over to us, okay, we're at that screen now. There's some of those solutions.
Yes.
Talk a little bit about that.
So to kind of wrap up what we want, what is the solution? What we would like to see is put on hold hiring a permanent CEO. Our new CEO, Phillip Lowe, has been here about 3 weeks. He had to hit the ground running. He walked into a mess. And we'd like to have an inclusive discussion of what Greater Taos would like to see developed as a master plan for the hospital. We want to know what you want, what the community wants, what we all want for the future of the hospital, and then find a CEO who's going to be in line with what we want for Taos County, not bring someone in right now. It's my understanding that Quorum is recommending candidates to the board. They've had about 30 applicants, and they'll recommend the top 3 or 4, and the board will look at those. And these are people from out of town, out of state, possibly Spencer, who is here in town for the last couple of years. But we would like to see someone that's going to be able to fulfill the vision that we want to see for the hospital. We would also like to encourage Taos Health Systems to work with you as the county commissioners and the town government and the health study committee that's already in place to set up a series of public forums so that we can find out what everybody wants and develop a master plan for the hospital. We would like a review of the current lease by the county attorney. The existing lease might have served a previous set of circumstances, but we need to review it and determine what terms and conditions the county sees as necessary for the hospital.
Just a bit of time on that. Mr. Malone, any thoughts on the review of the lease by?
I've reviewed the lease and I can discuss it, but I can't make recommendations about changes because that's a matter of policy.
Okay. So maybe it's an item that we need to put on the next commission agenda, Mr. Archuleta, so that we can have discussion on that and start approaching some of these suggestions at the next meeting so that we can make decisions. Mr. Archuleta.
If that's the will of the commission, yes, sir.
I mean, Mr. Chairman, I think we can discuss them today. There's no bar to us discussing them. I think Mr. Malone's point was he wasn't comfortable necessarily making recommendations for changes. That's our decision.
Right.
Exactly, and I'm prepared to answer any questions, if it's the will of the commission, I can give you an overview of the way the lease is structured, and I'm happy to do that.
Why don't we do that?
Okay. So basically, the start point in understanding the lease between, and let me back up a second. This is going to be a very general overview. This is not intended to be a lecture on the lease. It's 50 pages. We'd be here for the next 8 hours if I were to do that. But in terms of understanding in overview terms how the lease is structured for important legal reasons that I'll set out in a second, there's a real wall between the county commission or the county and the operation of the hospital. The lease makes very clear that the county has no role in operating the hospital except for major provisions in the lease. And the reason for that is twofold, and it's for the benefit both of the hospital but also, very importantly, for the county. The operation of a hospital involves huge liability risks, and we currently don't have any insurance that would cover the county for any of those liability risks. And by completely separating the function, there's a New Mexico case that deals with that issue and basically says to the extent that a local government entity is involved in operating a hospital, even if it's done through a nonprofit like THS or a management company, it exposes itself to liability. So only by building that wall is a barrier to that liability in place. I have no idea what kind of insurance would be available for the county or what it would cost, but that's the start premise, that the county has no active role in the operation of the hospital. It requires of THS, of Taos Health Systems, certain basic provisions. One is rent. There are 2 or 3 different types of rent that are being paid under the lease. The second is that it operate a general hospital, acute care hospital. So as long as it continues to do that, that obligation is met. It's interesting to me, there are a couple of items that that some of the commentary from the public has focused on that the lease actually does address, and it has to do with the issue of transparency. The financial records for the operation of the hospital are available to the county on request with the obvious protections against patient confidentiality, because those things have to be protected. But the lease provides that the financial records of the hospital are available. I think that is an overview, that there are rent payments, there is the operation of a general acute care hospital, and then there are some specific provisions about financial records being available. There's a great deal of very arcane legal provisions in the lease that I'm not even going to pretend to tell you that I understand, because they involve highly specialized areas of the law. This was set up at a point in time that bonds were being paid off. I think those obligations have now been met. There are a number of Internal Revenue Code provisions that are important to taxation. Again, I'm not a tax lawyer and I couldn't really comment on those, but I think I've given the general overview. Now, in terms of restructuring, some of the solutions that the union has suggested, those could only happen by mandate if the lease were renegotiated. The lease provides for a termination on 180 days if it's not for cause. And so in order to renegotiate, that would have to happen. The lease has to be approved by the State Finance Committee. And so there are a number of things that are not simple, just sort of the county can dictate that this is the way the hospital is going to be run. That can't happen. At a minimum, the lease would have to be changed. I'm sorry.
So, Mr. Malone, right now, we do have a definite date as to when the lease is going to terminate. What is the deadline on that?
Well, that's so many years in the future, I can't give you the exact date. It was a 30-year lease, and it was signed in 2000 or 2001, so that would be 2030 that it would terminate without it being terminated by notice. It could be terminated by notice with 180 days notice.
Okay, so 180 days notice to terminate by notice, but then during that time, you also have to look out for other potential boards or companies that want to come in and manage the hospital. And on top of that, it also has to be approved by, at the state level.
Exactly. I mean,
and so you're looking at easily a year before that change could actually take place.
Easily. I mean, it would be, this isn't lawyer advice, this is just common sense. It would be a mistake to terminate a lease and not have a program in place to replace it. And so that's a pretty good overview of there are provisions for termination for cause. They require 30 days notice with an opportunity to cure, but someone would have to identify one of the very limited rent payments, operation of the hospital as an acute care hospital, request for financial records that hadn't been met in order to invoke those clauses.
30 days versus 180.
Well, it's 30 days with an opportunity to cure, so it would be more than that.
Okay.
All right.
Mr. Chairman, I have a couple questions for Bob. Bob, has the lease been prepaid for a 10-year period?
It was prepaid, and I don't know if it was exactly 10 years, but it was roughly 10 years. It was $800 and some odd thousand. That, I think I can anticipate what your question is, Commissioner. That money does not have to be paid back if the 180-day termination clause is utilized.
Wow, that's a good deal.
Yeah, I have to credit whoever the county attorney was that, I think it was Barbara Martinez, but whoever the county attorney was when that was done had the foresight not to require repayment of that money.
Is there a provision within the lease that allows, that is currently being practiced, wherein a county commissioner is appointed to the committee that interviews new board candidates? Is that part of the contract?
I don't know if that's part of the lease or not. I'll check into that for you.
Mm-hmm. Thank you.
Martha.
Thank you, Counselor. And can I just say, we are definitely not asking for the commissioners to run the hospital. Just like I wouldn't expect you to come to the ICU and try to take care of my patients. I would hate to have to sit in your seat and try to do what you do because you guys are so great at it, and I am really not. All right, next. The next thing we're asking is we demand that Taos Health Systems consent to a serious and independent assessment of Quorum, who is our management company, and all other management contracts and decisions that are sending resources out of the county. Apogee, who's out of state. Aramark, who runs our dietary and laundry and maintenance, are out of state. And we have other contracts that are sending resources away from Taos County, and we'd like to look at that to see if that's really the best option for what we need.
Mr. Chairman, if I could just ask a couple of questions on that. I've been hearing about this outsourcing that's been going on. Have you guys been updated as to what cost savings that it has at all? Is there figures anywhere that we could look at or that the commission could look at, reference outsourcing? You know, when we're talking about 18 doctors going to one doctor, what's the cost savings of those 18 doctors? When we're talking about the laundry services being outsourced to a different community, usually you do that for a savings purpose.
Right.
If that's what you're going to do, which, you know, requires
We do have next week our forensic accountant and economist from the union is coming to look at the hospital books. Okay. And he will be making a report to the community task force that meets next Wednesday night. And you're all invited, you're more than welcome to come and hear his report and see what his independent assessment is. All right, the next thing.
Mr. Chairman, just real quick, you know, the Apogee contract does have a provision in it that if they don't save 180 grand a year, then the contract is basically violated. So that's like one of the performance standards within that. I don't have any of the other numbers. Spencer probably does, and I'll leave it up to the chairman.
Thank you. Also, we would really like to encourage Taos Health System to develop a request for proposal from other potential providers of health care for the hospital. So possibly UNMH, they're already in dialogue with them about other things relating to the hospital and bringing in providers. But we know that quorum is not the only game in town, and the other management companies are not the only people out there that can do an effective job. And perhaps we can find someone that can do it better for less resources. And if Taos Health Systems is not willing to work with the county to accomplish the intent of what we want, then we're asking the county commissioners to pursue all options available to take back control of the hospital, including serving notice to Taos Health Systems. They will seek a new RFP for occupying the hospital from all interested bidders. We really need transparency and inclusiveness on the part of the hospital board and administration. We don't want the hospital to fail. We want the hospital to be here for a long time. We want to be able to work together. And we aren't the only ones who feel this way. We took a petition to community with these same concerns, and over 600 doctors, lawyers, teachers, mothers, and concerned community members agree with us and signed our petition. These are local people who live in the area, who use the services of the hospital, who want to see change at Holy Cross Hospital. And finally, New Mexico law provides counties with the power to provide hospitals for the sick, which you have done, and we are very grateful that Taos County has a wonderful hospital building to help take care of our patients in. And the law says, upon terms and conditions as the county commissioners may determine. So again, we don't want you to run the hospital, but you can certainly determine the future of our community hospital. Something we've heard in recent months from administration over and over is about national trends in healthcare. 9 small hospitals in Georgia closed. Small hospitals are struggling everywhere. There are financial issues throughout the nation. And we realize that this is a very, very difficult time in healthcare. There are a lot of major changes. What we would like to do is create our own Taos trend for healthcare and work together for the future of healthcare in our community. Thank you, commissioners, for your time.
Thank you very much, Mark.
Any other questions?
Yeah, Mr. Chairman, Commissioners, thank you, Mrs. Jaramillo. And I want to thank all you folks that took that medical field. You know, I mean, it's a hard field to work at, and I compliment all of you. And I've got one concern is that outsourcing. You know, here, you know, we need jobs right now with Chevron Mining. That's 300 jobs. You know, we're trying to work with this one lady in Amalia, try to see what she can bring into our county to create jobs, and we're looking at 300 jobs that we may be able to work with. We've been talking to our elected officials up in state level and even in federal level. And this lady brought up the point about that boat, the hole in the boat. Well, it's not just a handful that can fix a boat. I think it takes a team, and I think we've got the team here. And Spencer, let me direct this to you. If you were selected, would you try and take care of the issues that these folks have?
Yes, sir. I mean, I think that this group here, actually, I get along with these folks fairly well. We've done some things that we've been working on to try to improve transparency. Sorry, do you want me to get up to it?
Go ahead.
Just for the record. Trying to improve transparency and improve communications, but it's not something that I can do alone. It's something that we have to embrace as part of our organization's culture. And as you all know, culture is not a quick thing to shift. I will be one of the first to admit we do have communication issues and we do have trust issues. To echo somewhat what Michael is saying, I think that there is a bit of a perception that just because somebody doesn't necessarily agree with someone's position that they're not listening to them. But again, that's a cultural issue that we have to be able to have the honest discussion and come up with why decisions are made. But I honestly don't think it's something that's going to be fixed overnight, but I think that we are on the right track of where we need to go to get there, but it's going to take time.
And Spencer, how would you see Taos County's involvement in all of this?
You know, I think that honestly having regular updates, quarterly updates of what our status are is an important thing. We've got our study commission with Commissioner Blankenhorn on there, and I think that that's a nice vector for information to come back from a larger group that's not necessarily being filtered through someone in administration. And I think having that type of communication venue where something isn't being seen through my eyes or something being seen through the union's eyes, I think that that's helpful also.
Okay. And also, Spencer, my ad, you know what, we just said it, teamwork, you know, and I have to compliment our manager. Since we brought him on board, you know, I see the county going in a positive direction. And he's the one that's leading that ship, which you just got to hold ours doesn't. So I think we need to work together, and you got to find staff, I think, there, Mr. Spencer. So,
you know, sir, I think it's important to say too, it's easy to communicate when things are going well. I'm from the military background, and when things are going great, communication is never an issue. But it's when things start to hit the fan that communication starts to break down. And the issue is we've been in a couple of years of consecutive financial losses. As Martha was saying, we're seeing industry trends that are very difficult to overcome, and that makes communication difficult. And we do need to recognize that we are in that situation where communication is tough.
And Spencer, with that new money that, every time there's a cut in funding, you see cuts in personnel, you see cuts in everything. And, we talk about, now that, I know we had thought there was going to be 6.4 million. That's kind of the figure we had put. Now we're looking at, there's a possibility of 7 million. Is this something that you think is going to fix some of the problems? And again, the greatest thing is Commissioner Sanchez brought up is working together. We got to have that balance, the balance with the union, the balance with the employees, the balance with staff, and working together makes that all work. But and there's some things, you look at even Chevron when they came in, and they were going to lay off people. They knew a month, 2 months ahead of time, as you guys did. And there's certain reasons why you don't tell people about layoffs ahead of time. And there's a balance that needs to take place. And hopefully we can, let people know about that balance that needs to happen, and we can continue to work together. But you think, again, the additional monies that will, I want to call them additional monies because they're not additional monies, it's just monies enough to bring back the hospital to the level that it was prior to the cutbacks?
I don't think that we're going to see it come back to the level that it was before, because there are other pressures that are hitting the hospital as well. We are seeing with the Affordable Care Act, we have seen our commercial insurances drop significantly, and we've seen our Medicaid go up significantly. Medicaid doesn't pay at nearly the rate that commercial insurance does. And we've seen that increase by almost 10% as people are losing their private insurance and moving to the state's Medicaid expansion. I mean, it costs an individual less on their pocketbook to do that, so I can't fault anybody for making that decision. But we do have to consider what the repercussions are financially whenever you do see those types of shifts happen. We have seen the inpatient volumes shift significantly from back when the hospital was making a fairly decent margin. Back when the hospital was making 3 or 4% margin, we have seen a huge shift across the industry and here locally of inpatient volumes going down and outpatient volumes going up. And that has a financial factor with that as well. And I think that we're going to see that trend continue for the next couple of years before we see it start to level off. And I think that that's going to be tough too, because it changes not just how you budget and how you forecast, but it also changes what these guys have to do. I mean, your work is changing on a day-to-day basis, and we have to be able to change along with that.
May I speak
Sure.
along with that, Spencer? I agree that we have seen a lot of different changes within our patient load and who those patients are. One thing that I believe as a community member that we need to address in Taos County is how many people are getting shipped and transferred. And those transferred numbers, just like unemployment numbers, after the person goes through a certain period, those numbers disappear. Many of the patients are getting transferred before they ever through EMS and not before they ever hit the door of the Holy Cross. And so some of those numbers of inpatient care are reflective of pre-transfer, I guess I would call it, in which the hospital has been contacted and the EMS workers are aware of the bed availability or lack thereof and sent further down the road before they ever even come to Holy Cross. So our numbers of inpatient have declined. Some of it is because we closed beds too. So, and we closed ICU beds. When I look at the reasons for people leaving and getting transferred out of the ER, not the hospital, many of those conditions and things were patients in which we would have taken care of 2 or 3 years ago. GI bleeds, asthma. This was just this last week. Conditions I don't understand why we wouldn't be able to take care of them as an inpatient at Holy Cross, other than maybe we didn't have the staff or we didn't have the bed availability. So it is a complex issue, and I'm not trying to set fault on any side. I just be aware that there's a lot of facets to this gym that we need to try to figure out to make it a gym of a hospital.
And I just want to play off another facet. Is it something that the type of care that is now in place doesn't allow for that inpatient care where before it allowed for it?
Occasionally that may be the case. One of the surgeons that resigned a year and a half ago was our intensivist, and what that means was that he was a surgeon, but he also was basically ran the ICU and did the intensive care part. The other surgeon was a trauma surgeon, and so we do have new surgeons to our facility and very good surgeons, but they have different scopes of practice. And so their ability to take care of a trauma or a intensivist patient is different than Dr. Masson or Dr. Sermons.
And then the reason I ask is I've had a couple of family members that actually were going through some type of surgery, and before they were allowed, you know, a day or two to stay in the hospital, and now they were not allowed to stay in the hospital. The procedure was done, and then they were shipped out because they say their care didn't allow them to stay the additional days.
We also have lost, after the layoffs last fall, we had a lot of nurses who over several months found other positions and are no longer with us at Holy Cross. Some of them are still in the community. Some of them, I can't imagine doing this, but I hope I don't have to, are commuting to Rio Rancho and other places to work. So as that progresses, will they physically be here any longer? I don't know. That would be a tough one to commute for that long.
Thank you.
Okay. So as far as the number of inpatients, what are the percentages of what we have now versus what was there a year ago? How much has it dropped as far as the patient numbers are concerned?
I think the administration would be better to address that, but just looking at that on a day-to-day basis, I know I came here in 2007 and our census typically was around 35 to 40 people inpatient. Now our census tends to be in the teens, and we cap out at 29 total. So again, I think it's harder to manage an average when you're managing an average of fewer beds, because if you're trying to reserve a bed open for surgery that is happening, and then somebody comes and bumps that, and you have 2 beds in one unit or 10 beds in another, et cetera, it's harder to manage than if you had 6 beds and keeping that one bed open for the what if. And we do have to plan for the what-ifs. That is what a hospital and emergencies and things are made of, is what if that happens to me? Can I get care here in Taos?
Okay.
Mr. Chairman. Thank you. You know, I do agree with everybody who's spoken in the union that the prior board and to some extent the prior CEO definitely could have been more open and transparent and trusting with the information that was so critical to the hospital. And you cannot underestimate the negative effects on morale of those kinds of things. And Spencer, I hope that if you're successful that you'll take that into consideration and you know, avoid the kind of brought to the principal's office stories that we've heard today. All of that being said, there was a big old hole in the ship. You can't go from 9 million to 2 million without doing something drastic. And you can see the bar charts of the cash reserves going down in a scary fashion. I don't know that there was an option other than reducing ICU beds. You know, at the committee, the administration has shared with us what portions of hospital functions make money and what portions of hospital functions lose money, and the ICU was clearly in that. You know, you've got the emergency room and the I can never say that, yeah, that one, and the ICU that were all the money losers, and the only one that you could cut was that, and so. I'm sorry to hear from Spencer that even with the hole now being filled, it doesn't seem likely to him that will be able to be raised again, because obviously the more ICU beds you have, the better you can care for your community.
I would like to interject something, is that I know part of what I do is a money loser. But it's a necessary thing which we provide for our citizens here, and I thank you guys very much for supporting that. And the parts that we're losing more money and that we haven't really figured out the true cost of this is all, as a community member, if I have a loved one or myself that's shipped to Denver or to Albuquerque or even as close as Santa Fe, what is that cost when I get the bills for a life flight? I have all these people in the community saying that they realize from just hearing the choppers going day in and day out, leaving the hospital. I hear dollars leaving and the dollars getting sent to other communities, and the cost from households and neighbors, and what that true cost is going to be. I don't know what that is, and I don't expect you to know that either, but I'm just wanting to throw the net out broader in the discussion of what that truly cost us.
All true, but still, in order to keep the ship afloat, I don't know that there was another solution at that point. But, you know, I am hopeful. There are 3 new board members, and I can tell you, I served on the committee to choose board members 2 years in a row. In the first year I served, no one else was going to be considered except the existing board members. You could feel the closedness of even that committee, and you know, try as I might, there was really no budge. And this year it was a complete turnaround. It was wide open. There was a really fair and open process. And I happen to think that we got 3 really good, new, valuable board members, and I do think that that's going to make a difference going forward. I'm also hopeful because of the committee. You know, those meetings that we have every month, I think, are really useful. You know, I'm hoping that there'll be 2 board members who attend them regularly and who will answer our questions and give us updates on the CEO considerations, and you know, whether or not they're going to go beyond the scope of quorum. And I'm also hopeful because the big old hole has mostly been filled, at least in terms of indigent care. And so I do think that we have you know, reason to expect some good changes. Like Commissioner Sanchez said, the CEO is so critical to any operation, and so I'm really hoping that, you know, that choice is well made. because we can see it here in the operation of the county with Mr. Archuleta and with any organization. It's just so critical. So I wish the board good luck on that.
Thank you. I would just like to correct a couple of comments that were made, if you don't mind. Based on my expertise in rural health care, I chair for the National Rural Health Association a group called the National Rural Task Force, and we look at what is happening in health care. There's no comparison with the Georgia hospitals. The states where the hospitals are closing are states that did not do the Medicaid expansion. We saw no information today of the impact of the Medicaid expansion on uncompensated care here at the hospital in Taos. I've been to numerous presentations where we were given information that had been mapped out, how uncompensated care in many small rural hospitals is dropping in the states that have the Medicaid expansion, like New Mexico. We heard the amount that was from the past, not even from the present or the future. And I think that in some ways that was a disservice. And I hope that as this process moves forward, there will be other opportunities to present information, like all of the counties that have, in fact, dropped quorum, sued quorum for fraud and mismanagement and other kinds of things. I've got a lot of documentation on that. But the thing that we need to talk about is transparency means you go to the website and the financials are available to anyone who wants to look at it, not at a board. It's a public entity. With regard to malpractice and other liability insurance, there are numerous entities that do that. And counties also have protections because there are some tort protections that come into place with lawsuits. There are thousands of county hospitals in the United States, and they have worked out some of these problems on how to do it. But I think you are all owed a report, a financial report that looks at what the benefits of the Medicaid expansion are in New Mexico and what impact that's going to have on uncompensated care. And I predict it will look like some of the numbers I've seen from other hospitals. I had one hospital administrator tell me that they had gone from a large amount of uncompensated care to actually turning a profit and having funds available for other things. And the only other fact I want to correct is, yes, doctors and medical providers are an expense, but they are the only income generator that you have. So to only look at what the expense side is doesn't, it has to be covered more by the revenues they bring in. Without a medical staff that is trusted by the community, you can keep your doors open, but you will not be generating revenues, you'll just be generating costs. So, just to make the point again, open meetings and open books are really the only thing needed to keep this hospital a public hospital, a community hospital, and I encourage you to look at that. Thank you.
Okay, we're going to get ready to wrap this particular item. There are others to follow, but I was hoping that the commission would entertain a break, at least a 5-minute break. But first of all, I would like to have Mr. Archuleta say a few words.
Mr. Chairman, Commissioners, I guess what we're looking for is going forward, what would staff recommend here and how we would do this. First of all, I want to thank everybody for coming out today. I think that it took time out of your busy schedule, your families, to be here with the commission, but I really appreciate the comments that were put out here by both the administration and by the workers and the union from the hospital. I think that Taos County has a couple of options to move forward. We all heard the word transparency, and in that aspect, Taos County can help with that transparency by requesting some of the financial records, have the commission review those financial records on an ongoing basis. I know that we have two individuals, Mr. Cordova and Commissioner Blankenhorn, that actually sit on the special committee that help promote the new board members and the nominations, but there's also that task force that continues to look at the aspects of the hospital and how that's moving forward. And so with that, we can also continue to put that on the commission agenda for report back from them. And also then they can also take some questions back from the commission as far as what are some of the next steps and issues. The other issues that I've written down here is the impact on the community. We've talked a lot about a lot of our individual family members leaving the community to go find jobs other places, having to drive 40 minutes to Espanola or sometimes 2 hours to Albuquerque to actually work down there. But one of the things that the commission hasn't really looked at and is something that we really need to consider and staff needs to present some kind of an impact is that because of the lower amount of beds that we have at Holy Cross Hospital right now, those families are being shipped out, as we just talked about, to different hospitals across the state of New Mexico as the helicopter leaves Holy Cross and takes them out there. With that, you usually have a carload of family members that are actually going to Albuquerque, Santa Fe, Presbyterian, spending countless nights down there, trying to stay with family members. Kids aren't in school because of it. It's just an impact on our community. People are missing work. Kids are missing school, family members are being displaced, and sometimes our elderly folks are either left at home wondering what's going on in Albuquerque and how that family member is, or they're actually going down there also, even though they're on oxygen or they have some of their own illnesses. And so that impact is a huge impact that's happening within our community. There's also an economic development impact that happens. Businesses don't want to come here, families don't want to come here. A lot of our people that visit our community don't want to come here if they know that our hospital is in a flux and there's issues or if they're going to get the right services. So I think we have a huge task in front of us. I think that the commission has some policy decisions that they will make in the future, and when staff will continue to provide as much information to the commission, try to gain as much of that information as we can, and try to keep the commission updated on that. There was a lot of concerns that were brought up today. As you heard from the commission and from our legal team, some of those concerns can be addressed through the lease. That would probably take about a year's time frame in order to do that, but we should really look at all alternatives before we step into that and move forward with that. And so staff will be bringing some of those concerns, some of those issues and recommendations forward to the commission as time goes on. Okay. I'm not sure, Mr. Chairman, if the commission had any other specific questions on that, but those were some of the items I jotted down.
Thank you, Steve, for those recommendations and some of those thoughts on how we need to move forward with this.
And the only question I had is, a number, Steve, and maybe from the hospital, we can get, we talk about a number of people that are being flown out, but even if our hospital was totally staffed, how many of those would still be flown out? That's something I would like to know, because, there's some of those serious problems that we have that arise that no matter what, we don't have the specialties to be able to I guess, move forward in their care. So that's one thing I would like to know too, is how many of those would still be flown out no matter if our hospital was totally back to where it should be.
But with that, it wasn't that way, correct? I mean, it used to be that, if there was an accident or something, someone broke their leg, they had a heart attack, they would be able to stabilize that individual.
I'll speak to the first winter that I spent here, and I like to use the phrase, I was born and raised professionally at UNM, so I was used to having a trauma and all the specialties there, and knowing that coming here that wouldn't be the case. I was impressed that we had an internist at the time and an intensivist who was Dr. Masson, and we took care of a lot more complicated cases, and at this time I don't think we can. That first winter, going back to that moment, I remember having 3 septic patients in the ICU out of 6 beds, and sepsis is where you have an infection in the whole body, and the odds of surviving that is a 50-50 under the best circumstances. And when I came back from my winter vacation, 2 out of the 3 survived, so I was impressed.
Okay, go ahead.
Hi, my name is Todd Nalaboff. I work in the IT department. I am neither management nor am I a union member. Being an IT guy, though, however, I am a fan of numbers. And based on your question about where things were before as opposed to now, I can give you exact numbers that prior to the changes made with the beds in the ICU, we had a transfer rate of 3.1%, as opposed to now in the last year since the change where it's been 3.8. Well, so there has been an increase, but it may not be as drastic as it's been made out to be. So, just wanted to point that out.
Thank you.
Okay. Motion for a break?
So moved. Second.
Because there's also patients who are not actually even getting to our doors because the EMS personnel are saying, no, we're not because they don't fit what is available services-wise here at Holy Cross. It's because they already know that because of the numbers that we have at the hospital, they can't.
Right, and I can speak to that. I'm a volunteer paramedic also with the Cuesta Fire Department, and once in a while do a paid shift to help them out. And when we have two lower skill level people working the ambulance and they think the patient is too sick to go to med-surg, they call the helicopter right away. So I know there are patients out there that are not even making it in the doors of the hospital. So I don't know how we can track that. But I also know that in the emergency room, they track when patients are transferred to another facility from the emergency room, but it doesn't always say they were transferred because there is no bed. Or it just says they were transferred for this, which is something that we can take care of. So to look at the real data, we need to know the real reasons why people went from A to B.
Okay, thank you.
For that point, we actually do get a daily report from the CCO telling us the transfers and why they were transferred out, and we could actually probably provide that information in terms of the percentages that were transferred out due to no bed as opposed to the service needed.
But that's not included in the 3.1 to 3.8 that you quoted?
No, the transfers are included. No matter what they're being transferred out for, the 3.8 is the number, whether it be because of beds or because of services required.
So the 15% rise in transfers since the cutting of the ICU does include those that EMS...
No, that we can't speak. As Martha pointed out, there's no way of really tracking that. We don't. It could be the same as it was before. Again, there's no numbers to show one way or another. Thanks.
Mr. Chairman, Commissioners, we can actually track that through the county side for the number of transfers that our current EMS is doing, and on their calls, their call log, Joaquin can actually give us those numbers, and then we could check with the Red River also, who is the other ambulance service in Taos County, and see what their numbers look like.
Okay. So there is a motion for break in a second. Madam Clerk.
Commissioner Blankenhorn.
Yes.
Vice Chair Sanchez.
Yes.
Commissioner Brun.
Yes.
Chairman Romero.
Yes. Okay. Let's just go ahead and start. Motion to come back into session. Okay, Madam Clerk.
Vice Chair Sanchez.
Yes.
Commissioner Brun.
Yes.
Chairman Romero.
Yes. Commissioner Blankenhorn is coming in.
Present.
Okay. Okay, we'll move on then to item 6C. This is review of the changes to the Indigent program. Ms. Tammy Jaramillo, welcome. Indigent Fund Coordinator.
Good morning, Chairman and Commissioners. I'll be presenting to you today some of the highlights on the Senate Bill 268. It's a very complex bill, so please bear with me. I might stumble, but I'll do my very best. So the first slide is the purpose of the Indigent Hospital and County Health Care Act. And it's to recognize that each individual county of this state is the responsible agency for ambulance transportation, hospital care, or the provision of health care to indigent patients domiciled in that county, as determined by resolution of the Board of the County Commissioners, in addition to providing support for the state's Medicaid program. Also to recognize that the counties of the state are responsible for supporting indigent patients by providing local revenues to match federal funds for the state Medicaid program pursuant to Section 7-20E-9 NMSBA 1978, and the transfer of funds to the county-supported Medicaid fund pursuant to the statewide Health Care Act, and to recognize that the counties of the state can improve the provisions of health care to indigent patients by providing local revenues for countywide and multi-county health planning. The second page is the Safety Net Care Pool Fund created. This is took over the sole community provider fund. The Safety Net Care Pool Fund, which shall be administrated by the department, shall consist of public funds provided through intergovernmental transfers from counties or other public entities and transferred from counties pursuant to Section 16 of this 2014 Act, which is Senate Bill 268. Money in the fund shall be invested by the state treasurers as other state funds are invested. Any unexpended or unencumbered balance remaining in the fund at the end of any fiscal year shall never revert. Second, money in the Safety Net Care Pool Fund is appropriated to the department to make payments to qualifying hospitals. No Safety Net Care Pool Fund payments or money in the Safety Net Care Pool Fund shall be used to supplant any general fund support for the state Medicaid program. The next slide is the powers and duties of the county. So this is basically the highlights what the counties are obligated or their duties are. Under 27-56, powers and duties of counties relating to indigent care, a county may budget for expenditures on ambulance services, burial expenses, hospital and medical expenses for indigent residents. Then it goes on to D, which shall transfer to the state by the last day of March, June, September, and December, equal to 1/4 of the counties pursuant to Section 16 of this 24 Act, which is the 1/12. That's the quarterly payment. This money shall be deposited in the Safety Net Care Pool Fund. With that is the 1/12 that's obligated by state statute. The next one is may contract with ambulance providers, hospitals, or healthcare providers for the provisions of services for indigent patients domiciled within the county. So
that new wording on where it says on G, it says may? Or?
Yes. Yes. And also, if you look on A, that's also new wording, may budget. The next one is 27-5-7.1, County Health Care Assistance Fund, authorized uses for the fund. The fund may be used to pay for expenses of burial or cremation of any indigent person, ambulance transportation, hospital care and health care services for indigent patients, county administrative expenses associated with fund expenditures. The fund may be used to meet county's obligation under Section 27-10-4, and that is with the Medicaid payment. Also, the other thing that I wanted to mention that's not here, just for you guys to be aware, is in Senate Bill 268, there's a section that the county commissioners can impose a tax, but that only gives you 3 years to impose a tax. So just a word of caution. But also, I want to let you guys be aware too, is that the formula, it's an administrative formula that comes from HSD, and that formula that they currently have is good for 4 years. So the third year, what I am told is HSD can change the formula. So just for your knowledge, that the formula can be changed, and you only have 3 years to impose the tax. I know that there's going to be some discussion later on in regards to a tax to repeal. The next page, powers and duties of the hospital. 27-5-11, a qualifying hospital shall accept every indigent patient who seeks health care services from the qualifying hospital. Within 30 days of receiving a payment from the safety net care pool, a qualifying hospital shall report the amount of such payment to the county within which it is located. The next one is, a qualifying hospital shall annually report to the county within which it is located the total cost of health care services provided in the previous calendar year. So we will be getting reports from the hospital in regards to the 1/12 that they'll be receiving from the safety net care pool. I got to get used to these. Yes. What assistance is provided currently, next page, sorry, is burial for unclaimed, ambulance transportation for EMS claims, and as of July 1st, we're no longer doing co-payments. Senate Bill 268 has taken out for the counties to be paying co-payments and hospital care. The next slide, please. What direction? What additional medical assistance can be provided? Additional medical claims, mental health claims, drug and alcohol rehabilitation claims, and dental claims. These all fall in the scope of Senate Bill 268, what we can pay, what is considered providers. The next one is should we pay by claims or contract to providers? Pay by claims until, my suggestion would be pay by claims until programs are established, because some of these mental health, drug and alcohol, and if you choose dental, in the past, we haven't really focused on these areas, and it may be because we were paying at retail rate for medical claims, and that took a pretty good chunk of the resources. So at this point, we don't know what the cost is going to be or what the demand is, and but it does have to be direct patient care. The next bullet point is need to repeal the resolution 2013-45. That resolution is completely outdated with the new Senate Bill 268. Or create policies for the programs that the Commission would like to see us, if we end up going with mental health and drug and alcohol, we definitely would have to put some policies in place for those. Next. What is the Commission's vision? Your ideas and visions will be researched on how best we can provide the assistance to the community in need of services. In August, I will present to you the programs with the policies that you have mentioned today. So I would like to hear from the Commission on what medical assistance you guys would like to provide or to focus on.
Mr. Chairman, Commission, I would ask the Commission if we could go on to the financial report that Ms. Jaramillo has next. Based on that, you'll see the amounts of money that is there, and then based on that, hopefully you guys can think about some areas of to expand that the Commission would want to look at, if that's okay.
Chairman, Commissioner, did you guys have any questions in regards?
Not yet.
Okay. So it would be the next. So this is fiscal year 2014, well, 2013-2014. So this is last fiscal year that we'll be discussing in regards to the contributions and payments to sole community provider / safety net care pool. So on this first page on the left-hand side, top left-hand side, you'll see on February the 5th of 2013, the Taos County Board of Commissions approved a total of $1.5 million to sole community provider fund. And here's the breakdown to the hospitals, and that's under sole community provider. On the next box below is payments made quarterly to HSD for distribution. So we made a first quarter and second quarter payments of, and it equals $658,480.02, which leaves $893,011.98 for the third and fourth quarter. If you go to the right-hand side, top right-hand side, HSD's distribution to Holy Cross for the first and second quarter payments is a total of $275,222. They also received from the MCOs, which is a managed care organization, which is part of the way they distribute the 3-to-1 match. They received a total of $1.7 million. For the first quarter, they received $955,243. Second quarter, they received $784,794. I didn't say that right, I'm sorry. And this came from the hospital. Those are the numbers that they gave us on Friday. So a grand total of about $2 million they've received. And then the next bullet, the next little box is January 1st of 2014, sole community provider program was replaced with the safety net care pool, which administratively HSD changed it January 1st, but the contributions was Senate Bill 268 format starts July 1st of 2014. HSD has sent us a letter requesting payment for the second half of fiscal year 14, which is an amount of $234,789, using the format of the safety net care pool that starts July 1st. So if we were to pay HSD that amount, the balance of the committed amount would be $658,221.98 that was committed to the sole community provider fund for last fiscal year. Do you have questions on that one? So the next page, please. I call this the gap. So from January to June, we took payments. Well, let me go back a little bit. So from January to June, there's no sole community provider fund. There's the safety net care pool starts basically July 1st on the contributions. HSD requested the second half, which is the $234,000, following the format, and this kind of goes with the format that they used, enacted in Senate Bill 268, based on the fiscal year 13 taxable gross receipts tax. Estimated amount equal to a GRT rate of 1/12 in Taos County is $469,579. I didn't say that right either. Half of the amount for January to June is $234,789. HSD cannot precisely estimate hospitals' payment, whatever Holy Cross would receive for the third and fourth payment. On the top right-hand side, you'll see claims approved for the first half of fiscal year 2014, which is from July to December, at the Medicaid rate of $315,042.42. Claims for the second half of fiscal year 14 from January to June is estimated, and the Commission has not approved any claims from January to June because, first of all, we didn't know, we knew that there was going to be a change. We just didn't know what kind of change. So we continued to take applications until June 30th, which at the Medicaid rate, I estimate it's going to be about $389,068, which is over $1 million in retail rate. I did speak to the hospital as well, and they came up with about $1 million that was due within the fiscal year of 2014. But some of those were at retail rate. They weren't at Medicaid rate, or it wasn't the actual copayment, it was the full bill of the patient. So we're in agreement that it's going to probably, once we sort out all that, that it's going to be around $400,000. So a total of $704,111.24 would be for claims in the fiscal year of 2013 and 14. So the next page, which is the options. County pays to HSD. There's no commitment of the amount Holy Cross will receive for the second half of the year. County does other, they can give a direct payment to Holy Cross, but there will be no matching funds. And the remainder, if you choose to utilize the remainder of the funds to pay claims for mental health, drug and alcohol rehabilitation, and dental. So those are some options in regards to the money that's remaining or the full amount. The next, around the state, this is what, there was an email that was sent out. These are the counties that have responded on what they're doing. Payments to HSD are 4 counties that are paying. For non-payments to HSD, there's 4 counties that will not be paying. So the other counties, I know Santa Fe County is waiting for a response from HSD, and some of the other counties are just have not responded. Steve, you probably know more of what the other counties are doing. Sorry to put you on the spot, but.
I'm used to it. Mr. Chairman, Commissioners, as you can see from that, usually the smaller counties, the formula that HSD has worked up works better for smaller counties. I think Spencer also talked about that this morning, that we're kind of fortunate in Taos County that because of the formula, it worked out a little bit into our favor. As you can notice from the right side of the paper, Chavez County, San Juan County and Doñana County, which are huge counties, and Curry County have all decided not to pay because obviously they're going to take the biggest hit as that goes on. Some of the other counties were still going to their county commissioners this week and next week, and so that's why they haven't responded, as well as Taos County has not responded because we were waiting for direction from the commission to move forward on that.
the next slide. The recommendation is to make payment to HSD with a memorandum of understanding with Holy Cross to honor claims submitted to Taos County from January to June of 2014.
So you need a decision from the board on that, and the recommendation is yes, to move forward with it.
Mr. Chairman, Commissioners, try to get through the meat of this whole thing. Basically, HSD is requesting $234,000 from the Taos County Commission in order for them to issue the third and fourth quarter payments to the hospital. As Ms. Jaramillo stated earlier, they have not given us a guarantee of what that $234,000 would be coming back to Holy Cross Hospital, and we don't know that. Our hope would be that it would be coming back in the aspect of close to $1 million on a 3-to-1 match, or however the formula works out. The fear is that because the larger institutions across the state or the larger counties have already said we're not giving that, we're not sure if even any money from the 234 would actually come back to Taos County. Our hope would be that it would. The Taos County Commission can actually make a determination to whether to give that to HSD and hope that that match comes back at a greater amount of 234. The commission can also say, no, we're going to give that match directly to the hospital in that amount, or the commission can redirect that money in the other avenues that were actually given as alternatives that House Bill 268 actually pushes forward.
And so, Steve, as far as like counties like San Juan and Chavez, the others, what is their reason for not wanting to?
They're actually taking a big hit. They were used to getting $14, $18 million because they're such big institutions and big hospitals that, you know, with the formula and the way the formula has worked out, they're actually only, you know, getting contributions back of $2 to $3 million, where in the past they had actually received a ton of money. And so they're balking at that because they're upset for that. What the formula does do is it helps rural hospitals and smaller hospitals throughout the state, and so it's actually in the favor of smaller hospitals.
So for us, it's kind of like a gamble at this point then.
Well, it's kind of a gamble. My hope would be, I think the other thing that the commission has to take into consideration is, as you see the numbers, we have a total of about $800,000 in that account. We had committed $1.5 million. Out of that, we've given about $600,000 approximately to the Sole Community Provider Program. And so we still have that money that's a specific use. I mean, that money we can't redivert it or send it someplace else. It's for indigent care in Taos County. And so based on that, you know, we have to, you know, we would, if we decided to, or if the commission decided to give that over to HSD, and hope for a higher return to Holy Cross Hospital, the commission would still have some money left over that they could direct staff to look at different processes in order to move that forward.
How soon will we know whether the hospital will benefit more?
That's the $1 million question, Commissioner. We've been asking that since we were at the New Mexico Association of Counties meeting in Clovis last year. One of the biggest concerns that we had was, what's the formula? They didn't have it. What's the rate of return? They didn't have it. And you know, one of the questions, I believe I asked this question was, can you guys guarantee that Holy Cross Hospital will at least get the amount of money that Taos County is putting forward, being that it's our tax dollars going towards this? And they wouldn't answer that question. They said they couldn't guarantee it. What we found out and what we've seen is, based on what's been given so far, the formula is in our favor, and our hope would be the first and second quarter we paid $600,000 approximately, and we've received over $1 million.
Actually, it would be
pretty close to $2 million total, $2,015,000. Right. I mean, so it did work out for Taos County. It did work out for us, and our hope would be that with the contributions of the $200,000 plus, that we would get some of that in return.
But you're saying that those 5 counties that are not going to pay into it might, in fact, hurt us?
Well, then I'm not sure if the distribution changes. I'm not sure what the formula sets in place. I mean, those are all concerns that staff definitely have.
But also, we need to, for the first time, HSD is also contributing state general funds revenue from its current year budget. So HSD is also going to be putting money in as well. So I don't know if they're going to take the hit for the hospitals that aren't participating or how that's going to work out, but HSD is also going to put money in the fund.
The possibility of getting some match is good.
Yes, sir.
That's what they're saying.
Okay, Mr. Malone, Tom, go ahead.
This is just a quick question for Spencer. The money that you described in your presentation, the $5.1 million, is that based on what Taos County has already contributed, or does that require additional contribution?
That's going to be the 1/12 coming forward from Senate Bill 268 that started this.
That's future. That's not past. Okay.
Correct.
Yeah, that was my question too. So by us giving this money, then the hospital is likely to get, under the current estimates, the hospital is likely to get $5 million. No?
No. Let me try to explain that a little bit. $5 million is what the hospital will be getting come July 1st, 2014, moving forward to June 30th, 2015. And that's at a rate of 1/12 is what the rate would be that Taos County would have to pay for that. What we're talking about right now is the the $234,000 that HSD is now asking us to pay. It would be hopefully an additional match that they're going to get from January 2014 to June 30th, 2014. And so that's why we've also put in the recommendations that if that's true, then we're also asking Holy Cross Hospital to write off the claims for our constituents from January to June of that we just finished.
And how much was that total? 9 million, wasn't it?
Of the claims?
Yeah.
Commission,
to write off the ones to write off?
About $1 million.
no, for January to June is Medicaid rate $389,068.
Okay.
I didn't know there was an opt-out provision in that law. In other words, so where San Juan County can say, no, we're not going to join up, is that part of the law, or are they just being rebellious?
Mr. Chairman, to answer Commissioner Blankenhorn's question, the monies that all of the counties committed well over a year ago, because we committed them for the now concluded fiscal year, those monies were committed, and I can only comment about Taos County's documentation, but Taos County's documentation was we committed $1.5 million on the basis of a very specific formula. In other words, there wasn't any guessing game about what the return would be, and the documents that then Chairman Baroni signed included the formula in there, and it showed an amount that Holy Cross Hospital would receive. What those counties that are not paying are saying is, we signed documents based on that formula, and if you're not going to pay on that formula, then we don't have any obligation to pay.
And that's just for that one interim period. But
for that limbo period that Tammy described.
But afterwards, they obviously have to.
Afterwards, they have to by state law.
Thank you.
So you need a decision. What is the wishes of the commission? You want to set a motion, Commissioner Blankenhorn?
Yeah, I'll set a motion to adhere to the recommendation of staff and make the payment with a memorandum of understanding.
To HSD.
I'll second that.
Okay. Any other discussion, commissioners? Commissioner Sanchez?
Chairman, Commissioner Tammy, one question on that, on the burial. That is just for the unclaimed?
That's what we're paying now is for the unclaimed. If the way it's written in Senate Bill 268, it doesn't say unclaimed. It's the verbiage is exactly the way I put it here. Let's see. may budget for expenditures on ambulance services and burial expenses, and then it,
Hospital, medical.
yeah, and then, but also where it says County Health Assistance Fund authorized uses for the fund, it states, the fund may be used to pay for expenses of burial or cremation of an indigent person. It doesn't say unclaimed.
So I think at one time, and correct me if I'm wrong, I think at one time we were paying that, and then we did away with it.
Right, but the law clearly stated that it was unclaimed. Now it has a different, the words have changed.
So we can help people that...
We'll have to research that.
Okay, yeah, okay.
But if that's the route that the commission, you know, if you want me to do the research for that.
Mr. Malone?
I didn't recently review the statutory provisions, but from memory, in addition to the indigent care statute, there's separate statutes that define indigency for burial purposes. And they're fairly strict definitions of indigency, so we would have to comply with those.
Okay, thank you.
Okay. Madam Clerk?
Yes.
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 Yes. Okay. Thank you very much, Tammy.
Thank you. Chairman, just to go back to the first presentation, on the last page, your ideas and visions in regards to what you guys want to see in regards to what the assistance we can provide. Will we be going the route mental health and drug and alcohol?
I know that Manager Archuleta and myself had a good meeting recently with the folks from, what is the name of the entity, Mr. Archuleta?
Tri-County.
Tri-County. They had some really great ideas, but they also have some great need at Tri-County. And I believe that we should include them part of this conversation as well, for the needs that they have, and hopefully we can move that way, towards that.
Okay. I just want to make it clear that my understanding, that's why I say we'll have to do some research in regards to, is that it's direct care, patient care, that we are actually able to pay on. Okay?
Okay.
Thank you.
Thank you very much.
Mental health and drug rehab is important within the community.
Yes.
Yeah.
Thank you.
Next item is the analysis of the third 1/8 tax. Mr. Leandro Cordova, welcome.
Mr. Chairman, Commission, just briefly before Mr. Cordova gets ready, we were looking at the agenda again, and under item 8, Resolution 2014-31, I believe that resolution would fit better right after Mr. Cordova's presentation, and that way there wouldn't be any confusion in the future. So if we could possibly entertain a motion by the Commission to move item A to item G under presentations number 6, and then Mr. Cordova can actually do the presentation or the analysis, and then we can move into the resolution on that.
Okay, very good. Is there a motion?
So moved.
Second.
Madam Clerk?
Yes.
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 Yes. Okay.
Mr. Chairman, Commissioners, we're just pulling up the presentation so that you guys could follow along. But basically what we did was we took a look at the third 1/8 increment. This is the one that we've been questioning because the second increment is what's required as an indigent increment, which the county has adopted and is basically where the 1/12 is going to come out of. That's a 1/8 increment. The 1/12 comes out of that. The county in the 80s went ahead and passed the third 1/8 also for the use of indigent persons, essentially, so we had double the amount. So what we're going to look at is how the third 1/8 is distributed and what it's used for at this time. You may have to turn it, if possible. So basically, the third 1/8 is broken into 50% goes straight to our healthcare fund, which is our 102 fund. The other 50% goes straight into our indigent fund, which is the 220 fund. Looking at some of the historical revenues, we went back to 2009, 2010, so you could see, if you'll keep going down a little bit, Dave. The most recent revenue for what went into the healthcare fund, so this is basically 1/2 of 1/8, was $406,620. So you can imagine the full 1/8 is basically double that, about $812,000 is what came in on 1/8 last year. If you go down, the next slide is the indigent fund. The indigent fund, and let me just go to the note at the bottom so you understand, the indigent fund receives the entire second 1/8, which funds the salary, benefits, and operational expenses, and in the past funded sole community provider, indigent and ambulance and burial claims. It also receives the other 50% of that third 1/8. So that's why the revenues there seem higher by about half of 1/8. So last year we brought in just over 1.2 million. The next slide shows detail of transfers. Historically, the healthcare fund transferred cash to the following funds, which is BEMS, Public Works, Solid Waste, and Detention. We still transfer to EMS and Detention. We no longer transfer anything to Public Works or the Solid Waste. And the last slide will just show you ending cash balance as of June 30. In the healthcare fund, we have $914,000. The indigent fund, just under $800,000. I stand for any questions on just the basic analysis of revenues for those two increments.
Any comments from other staff? Mr. Archuleta, Mr. Malone, commissioners?
Mr. Chairman, I think it's important to also note that this fund is continuing to grow every day. That's one of the things, is as those GRTs are coming in, the fund continues to grow. So this is a snapshot of what's there, and Mr. Cordova also gave you a snapshot of what's to come within in the far future.
Okay,
near future.
Chairman, I have a separate presentation on the way that the commission might affect the third 1/8, but I don't know if you're ready for that at this point.
Okay, why don't we do that? Go ahead. Commissioner Browning left. Done? Oh, he's mayor.
Mr. Chairman, Commissioners, the purpose of this presentation is to outline the options that are available to you in terms of repurposing the current dedication of that third 1/8. By way of history, the third 1/8, when it was adopted in 1988, required both an ordinance by the County Commission and that the matter go to a vote of the people. And the ordinance that was adopted said indigent persons. The referendum that went to the people said indigent patients. And the state statute also said indigent patients, so it has been my opinion that the funds are limited to indigent patients based upon that history. The statute at that time allowed half of the third 1/8 to be dedicated to that purpose, and the other half could have been dedicated to general purposes, but for whatever reasons, the Commission in 1988 chose to dedicate the full amount to indigent patients. The statute no longer requires that. The statute now allows that third 1/8, excuse me, to be used for general purposes. Obviously, from a fiscal perspective, having that flexibility would allow this commission and future commissions to take a large portion of funding and address it to the needs as they arise, rather than limiting it to one particular category. It could continue to dedicate that money to mental health or pharmaceutical support, for patient care. It could do all of that, but it would have the flexibility if some immediate and dire need arose, for example, a major bridge washed out because of flooding, to direct that funding to those purposes. So that's the background, and the Commission was interested in knowing what it would have to do that repurposing. I had provided 3 alternatives to you in your packets, and I have to take one of those back. As I was putting it together, it was my hope that I could give you an alternative that would allow you to repurpose the third 1/8 effective January 1st. But in completing my research, I've determined that a mail-in ballot, because of publication requirements for a proclamation of an election, which has a 56-day lead time, would not allow us to get it in place by September the 30th, which is when Tax and Revenue requires it be in place to effect it for January 1. So that leaves 2 alternatives that are in your packets that are viable, both of which would affect the change by July 1 of 2015. So as Tammy presented to you and as Steve presented to you, the money would continue to accumulate until the end of the current fiscal year, and the repurposing would take place the next fiscal year. There are 2 ways that can be done, but the first step in either of those 2 options is for the Commission to today pass a resolution for publication. And it would pass a resolution for publication for either of 2 ordinances, and those are the 2 alternatives. One ordinance would simply repeal the existing third 1/8. That would be effective not until July 1. And then as a separate action, this Commission could, under the current statute, adopt the third 1/8 with the general purpose dedication effective July 1 as well. So it would be 2 steps. One would be repeal of the existing third 1/8, and then the adoption of a new third 1/8. The other option is to amend the existing third 1/8 to allow it to be used for general purposes rather than limiting it to indigent patient care.
But you could do both.
You could do both, and the distinction between the 2 is the following, and this is the important thing that I want to make sure that the Commission understands. If this Commission or some future Commission wanted to make further changes down the road, for example, decided that there was a dedicated income stream that was necessary to some project and wanted to say the income from that third 1/8 will be dedicated to that project, which, as you know from other instances, comes up when we want to finance some project. In order to do that, that further change in the future, if you take the first option, which is repeal and passage of a new ordinance, you would not have to then again go back to the people. You do have to go back to the people for this step, but thereafter, because the new ordinance is adopted under the current statute, which doesn't require going to the people, you would have the flexibility of acting more quickly. Because as you've learned from this experience, when you have to pass an ordinance and then go to an election, it's a very lengthy process. It can take months and months, perhaps a year. If you just amend the existing third 1/8, that 1988 ordinance will still be in place, and further amendments in the future would require both an ordinance and going back to the people. So that's the basic difference. By repealing and passing a new ordinance, you would have the flexibility in the future to act more quickly. And I should point out that the people still have a say in the matter, because even when you just pass the ordinance and it doesn't have to go to referendum, the people, by collecting enough signatures, can force it to referendum. So my recommendation in terms of the ease of future actions by future commissions is alternative 1, which would be passing a resolution today for publication of an ordinance repealing the third 1/8.
And that opens it up to the next alternative.
That opens it up to passing the ordinance again, effective July 1st, so that we don't have any gap. We have one ordinance repealed and one new ordinance adopted that would create the general purposes. But again, it wouldn't be effective until July 1st.
So today, the only vote that you need is for?
A resolution to publish.
Okay.
And that would be the publication of the ordinance repealing the 3rd 1/8.
Commissioners, any questions or comments? Any recommendations? Mr. Archuleta?
Mr. Chairman, I think Mr. Malone made our recommendation from staff that we take alternative 1.
Okay.
So move.
Okay, I'll go ahead and second. Any questions or comments? Okay, Madam Clerk?
Yes. Yes.
Yes. Okay. The next item?
I'm not going to let the commission off that easy. So as Ms. Jaramillo stated earlier, so now we have to deal with the issue of, we know that by July 1st of next year, hopefully the voters will pass rescinding this 1/8, and the commission can repurpose the 1/8 for whatever purposes the commission sees fit. But at this time, the secondary question around that is that we still have that money generating within that fund, and will continue to generate until July of next year. And so we would want, staff would want some direction from the commission as to what avenues you would like us to look at, reference the use of, I'm thinking that it's going to be close to about $1.5 million by the time we get to July of next year. And so within that time frame, we have about $800,000 right now. That'll continue to generate another close to $800,000, and so we would need some direction from the commission as to how you would like us to proceed so that we can bring it in future meetings as to how we would spend down that amount of money. There's no time limit on that. That's the nice thing about it, is that that money is in there. We don't have to use it within a certain time frame to do that. So if we wanted to look at something long-term, we could do that, or we could spend $100,000 or $200,000 per year on certain projects, but it would have to fall within the guidelines of what the original ordinance was passed for.
Any thoughts, Leandro, from your perspective, and even from our treasurer?
Mr. Chairman, thank you for giving me the opportunity. As you'll see later on as I present our final budget, I'll show you some of the actual numbers for this last year. We did have a budget shortfall over the last year of about $769,000. So if you ask my opinion, that third 1/8 would be a perfect opportunity to close that gap. If it's generating about $800,000, that goes back in the general fund, and we do have that opportunity. So that would be my recommendation as staff, but of course, it's at the will of the commission.
Well, we've already done that part.
Well, let me first of all clarify. I'm not talking about how we're going to, in the future, use that money if it's repurposed, and I think that's what Mr. Cordova's relating to. I'm talking about the money that we currently have right now.
Right.
So that money, and Bob, do you want to clarify as far as what it can only be used for indigent?
And if I didn't make that clear in the previous presentation, by virtue of the referendum that went to the people in 1988, and by virtue of the statute that existed at that time, it is limited to indigent medical care. And when I say medical, I don't mean to limit it just to colds and flu, but
correct,
health care generally for the indigent.
And Ms. Jaramillo outlined a couple of options available to the commission for that. So I guess we're looking for guidance as to how we would pursue that.
Would really like to look at the needs of Tri-County, or what is it, Tri-County?
Tri-County Mental Health Services.
Yeah.
And Mr. Go ahead, Bob.
And one further just caution about that, because of the point that Tammy raised about procurement, if we contract with particular providers, I think we need to be careful about not identifying particular providers in advance, but rather the areas of service, so that mental health, for example, And it may be that Tri-County is the only one that can provide those services, but we don't know that in advance.
Okay.
So we would have to RFP that and get that out there.
Yeah, so, Mr. Chairman, I don't know whether it's it's probably best to get presentations to the board, right? I mean, invite people, nonprofits in the community that can provide these kind of services and convince us that that's a good way to spend tax money. It's either do that first and then do an RFP, or do some kind of a big RFP that would get proposals, and I would leave that to staff to tell us what works better.
And the only caution, I don't want to sound like a broken record here, Commissioner, but it shouldn't be in the context of those providers asking for money for themselves at those meetings, but describing the community's need for the services that in the service area that they provide, so that then when we present an RFP, if we go that route, there's no suggestion that it was prejudged in favor of those providers.
I just like staff's recommendation of how best to educate us so that we can decide.
Yeah.
Chairman, Commissioners, like I said in my first presentation, to pay out on claims until the programs are actually established, because we have to really be within the guidelines of, and this program has had some problems in the past. So my recommendation would be to actually pay out on claims before we actually would go out and contract with providers.
But we pay out all of our claims, and we're still going to have $1.5 million or so to spend, right? Is that, or am I missing something?
Well, if we expanded the type of, as I understood Tammy's presentation, we don't currently pay on, for example, mental health or pharmacy claims, but under the statute we could.
So that's the first thing we could do without anything else, without being educated by Tri-County or all of the other great nonprofits. Before doing an RFP, we can expand coverage. And do we have an estimate of how much that would use?
Currently, we don't have an estimate of that. It's definitely a need in our community. I think a lot of the stats definitely show that. And then we would have to settle what Tammy was talking about, the research, is we would have to research the procurement process of actually doing that and bring that back to the commission. So we can do that, and we can look at mental health, drug and alcohol, rehabilitation, and dental, I believe, were the recommendations that were put in front of the commission.
I like that idea. And I recognize that we need to take those steps in order to get to that point.
Okay.
And it'll be interesting to know exactly what the amounts will be after those needs are taken care of initially.
And that would be expanded coverage for any indigent within Taos County? Any indigent person as defined? Yeah. Pretty good.
Ms. Trujillo?
I want a clarification from Tam.
Do you want to come forward? That way the system can pick you up.
Susan Trujillo. And I just want a clarification from Tammy that these monies can only be paid out as they are defined by indigent persons, and that is they have to be paid out for specifically for them. So documentation from any contractor wanting to provide the services, that was the limitation that kept that fund from providing these services, was that they were not able to get the information that was needed to satisfy the requirements of indigent patients and as defined by the program. Correct, Tammy?
Well, on that, that's why I would suggest that we pay out the actual claims to make sure that we are in with the law.
The limits of the law.
Yeah, and also there has been something, let me see if I got the right one here. So Hospital and ambulance services or healthcare providers, which these mental health and drug and dental would fall under healthcare provider, that has contracted with the county for provisions of healthcare services shall provide evidence of healthcare services rendered for payment for services in accordance with the procedures specified, in the contract. So it would be in the contract stating that there would have to be, they would have to either application process, but that they, these clients or patients are indeed in need.
Okay.
I'm not sure if that answered your question.
Yes, it does.
Okay, any other comments? Susan?
And that was on the second portion, I believe the one that came to this point where we're looking at the third 1/8. I'm very pleased that this commission has followed up on really reviewing the purposes of the third 1/8. And because, again, we're seeing the accumulation of these monies in as they're coming into the county, and you see the huge gap that the finance director has alluded to, and we could best use it and let it be broad. The general purposes encompasses it all. The indigent, the overall services that Taos County provides to its constituents, but it gives the commission and the county a very good base, a revenue base to be able to work with. And I'm very, very pleased for today. Thank you.
And Mr. Chairman, thank you, Susan, for your role in bringing that to us also. And kind of related, you know, on the election, have we decided how we're going to educate the public? You know, it's somewhat complicated. We passed this 1/8 in the 80s. Now we no longer have the same needs because of the new state law, that sort of thing. How are we going to do that so that we are successful?
Well, we can't publicly promote it ourselves. The county can't do it, correct? Or can we?
I believe we can, not.
On this particular one?
We can only do educational, we can't take a position.
Oh, okay.
We can't spend county money and take a position.
Anyway, obviously it's something to think about between now and November, and just another thing to think about.
Well, Commissioner, we'll be working in that direction.
Sir?
Just as a suggestion, when we were talking about the community forums as connected to the hospital, that could be an avenue for that educational setting. So
this is a community forum.
Yeah, but I mean going out to the communities, because that's where a lot of people have a hard time, you know, spending the $5 even to come in from Penasco, for instance, just for gas.
It's a good idea, Walter. Thank you. Okay. Anything else? We'll move on to the next item then. Which one was it?
Item 7A.
Yeah, sorry about that. Go ahead. That's request for consideration and approval of Taos County Contract 2013-166. Mr. Sanchez.
Mr. Chairman, Commissioners, this contract is with Advanced Communications for the initial installment of the CAD software, records management, this whole software package for the new 911 center. And you have the exact numbers, should have the exact numbers in your packets, but it's approximately $246,000, $468, which included some bonding costs as required by our legal staff. So.
Yeah.
Oh, yeah, tax, okay. But, so this is for the new 911, the new software required to do our mapping, take the information from the new telephony and do records management for the base core of the project.
Can you give Richard an overall, just in a nutshell type of discussion or presentation on how things are going with regards to 911?
Things are going pretty well. We're a little bit behind on construction schedule due to some contracts between just procurement, but Motorola, our equipment is already starting to arrive in Albuquerque at the subcontractors warehouse. We'll be doing a kickoff meeting the 13th of August with our county manager, and I believe we're going to invite the commission also. I'll be going down after the kickoff meeting here to do an inventory of the equipment that's already there. Construction of the vault for the new sheriff's office is already complete with the exception of the emergency lighting and some light fixtures. The fencing around the new sheriff's office has been, there's a purchase order, contractor's been here and ordered material already. The remodeling is about 50% done inside there. Material for the remodeling requirements at the sheriff's office has already been ordered, the purchase order. Because of a previous commitment that I have in September, we may have to delay the installation beginning by a week or two because if I'm not here, there's nobody here to watch the project, so there'll be a couple of weeks that I'll be unavailable. But overall, we're on budget. Like I said, we're probably 2 weeks total at the most behind. Facilities has been helping a little bit with the construction. I've been doing all the construction myself, so we're almost there. We're getting there real quick. It's coming together very quickly. One note on this software, the software implementation will take about approximately a year because of the customization and bringing in all the different entities and data migration from the different entities. So initially when we do the cutover, which is tentatively planned for December 15th, which is a Monday and is historically a quiet 911 day, we will continue using the Sleuth CAD that's presently used by the county, by the town right now in the 911, while our system, our CAD programming is customized for the new facility and the entities involved. So hopefully the new system, the new CAD system, the CAD portion will be operational probably about this time next year. But with training and everything else involved.
We're still looking at how much time?
The actual dispatch move and start using the new dispatch, we are tentatively scheduled to go live from Gustorf to the new facility December 15th. That includes installation of all the new equipment and training of the staff on the new equipment. And then we'll cut over.
And everyone is on board so far?
It seems like it. Ms. Bishop, the 911 director, is looking forward to being in the new facility with all the new equipment. USFS has been here several times. It really looks like they're going to move over. They've asked for a sample lease. That's something that we'll bring to the commission, and some costs. They were here again on Thursday of last week to look at the space again and see how much space they actually need. It appears they may want one office and a little bit of what we were going to use as 911. It still gives us adequate space in the 911 for more consoles, but it would give them a single room for their dispatch area and then an office and a little conference room.
Okay, so as we get closer to these deadlines and when things are supposed to go up and about, maybe we can have more frequent presentations, reports to the commission.
Whatever you'd like.
Okay. Thank you very much.
And Mr. Chairman, how's the JPA with the town going?
Mr. Chairman, I spoke with Jake Caldwell last week. He met with Steve and and I did the first draft of the JPA. He had some minor changes, which, with one exception, we agreed to, and he was comfortable with the one that we didn't agree to. He's supposed to get back to me before Wednesday, before tomorrow, and confirm that he's prepared to present. I'd like to place it on the August 5th agenda for this commission, and that he's prepared to present it to the town council.
Great.
So it's imminent.
Thank you.
Other entities, Taos Ski Valley, are we looking at other entities that are going to come on board?
Mr. Chairman, in terms of the JPA, Jake Caldwell and I made the decision that drafting the JPA itself would be very difficult with 4 parties drafting it, and so we wanted to get over the hurdle of getting the town and the county on the same page. And then once the 2 governing bodies approve it, then we want to present it to the Ski Valley and to Cuesta.
Okay, very good. Mr. Lopez?
Mr. Chairman, members of the commission, I just wanted to point out a couple of things about this contract with Advanced Communications. The actual price, including gross receipts tax, is $287,232.78, but it also includes a provision that since the go-live date is projected to be December 15th and that the Spillman CAD software won't be available at that time, that Advanced Communications will transfer everything from Gustdorf over here to the county at no additional cost to the county. There's also a provision in the contract that the extended agencies, which are listed as Taos Police Department, Cuesta Police Department, Taos Ski Valley Department of Public Safety, and Taos County Detention Center, can be added to the software at an additional cost of no more than $83,000, inclusive of gross receipts tax down the road. And this price also includes the performance and payment bond that they did not bid, but they pass along to us, and it's an additional $6,700, which is included in that amount that I just stated. And so the software, including the training and implementation, is projected to be September 15th of 2015 completion, and then the maintenance will continue to 2017, and the warranties are in effect after the conclusion of the contract.
Questions, comments? So recommendation again?
Recommendation is to accept this contract. No matter which CAD vendor you speak to, unless you do just their basic system, all of them require 6 months to a year to implement and do all the customizations for multiple agencies. And it's just a fact of life. If we want to move to next generation 911, that's what it's going to take.
Commissioners?
So move. Second.
Okay, Madam Clerk?
Yes. Yes.
Yes, thank you, Richard. We'll move on to item 7B. This is discussion, consideration, decisions regarding the following additional documents required by the non-metro area agency on aging, AAA, as we know them, funding operations for Taos County senior programs. Mr. Archuleta.
Mr. Chairman, Commissioners, I wanted to give you guys a brief overview of what's been going on over the last 20, 30 days in Taos County with the senior program throughout Taos County. And then Mr. Malone will actually be presenting a document to the Commission for consideration to send back to AAA. Prior to the July 4th payment that we had to pay for our senior program in Taos County, as you all know, we took that over July 1st, and we had to issue payment the 1st. We were told by AAA early on in the negotiations that they would give us a 1/12 reserve in order for us to start our payroll process and move that forward. That did not come to be, and so the Treasurer's Office, Finance Department's office worked closely together and actually moved money out of our reserve fund over to our general fund in order for us to make payment with the Ancianos program, or the senior program within Taos County. Shortly after that, we received a letter from AAA stating that there was additional documents that Taos County needed to sign. And we were very concerned about those documents. Legal spent countless hours viewing those documents, going over those documents, and then we had a discussion with AAA that we were not able to sign these documents because there were certain things that they were asking for that Taos County could not produce. Part of that issue is that those documents were not given to us at the beginning of these whole contract negotiations. We actually had a contract signed by, approved by the commission, signed by the chairman, signed by AAA, and in place prior to July 1st. And now additional documents have been brought to Taos County, and additional affirmations have been brought to Taos County.
What are those additional documents?
We'll outline those here shortly, the attorney, but I wanted to give you sort of a background on it. So we've had subsequent conversations over the last 2 weeks with AAA. As late as yesterday, we were told that they would not fund us if we didn't sign those documents. Mr. Malone and myself got on the phone with AAA, their executive team, and negotiated what we think is possibly a good outcome for Taos County and for our senior program within Taos County. And so I'll ask Mr. Malone to go ahead and present that at this point to the commission and explain what the issues were that we could not feel comfortable with signing forward.
Okay.
Before I describe those documents, I wanted to just give a little bit additional background beyond what Steve presented. And we actually were first told on Thursday, less than a week ago, that these documents were somehow connected with funding. Mike Trujillo has been trying to get the funding from AAA since July 1, since the program has started. And he sent an email that they responded to last Thursday saying, oh, and these documents that we sent you a few weeks ago, by the way, if you don't sign those, we're not going to do the funding. We never want to get in that kind of a fight that ties up funding. And so the documents that they were asking for, there were 4 or 5 documents, all but one of them did not present a problem with it. They were never attached to the contracts. They were never presented to us as a requirement for funding previously, but I don't see any reason to pick a fight over things that don't really matter. So the 4 or 5 that don't really matter, there was no issue. I communicated to Tim Armour, who's the director of AAA, immediately that those were no problem. They had another document that was called assurances. And Commissioner Blankenhorn, in lawyers' terms, it's representations and warranties. I mean, they were asking for the county to make various representations to AAA about the programs. Most of those were also innocuous. Things like, we will comply with federal law, we will comply with state law, and so on and so forth. There were 3 specific provisions that I had serious concerns about because, Tim Armour said, well, this is just a standard document that we make everybody sign. I said, well, I don't know if everybody else has read it, but it requires us to do certain things. One, it required us to have an affirmative action program in all Taos County employment for the aged. That would mean, for example, and Steve used this example in talking to Tim Armour, when we're hiring somebody for the Sheriff's Department, for the Detention Department, where physical strength may be particularly important, we would have to give somebody extra credit if they were above a certain age. We don't have that kind of a program in place. We'd have to pass an ordinance to adopt that kind of a program. And so I didn't see how I could have this commission assure AAA that we were doing that. It just didn't seem appropriate. The second point was a confidentiality requirement. They had a confidentiality requirement in the contracts that we did sign, and they modified that because of the legitimate concern that I raised about the Inspection of Public Records Act. They were requiring that in the original contract that all of the files for any of the clients of the senior programs be confidential, and that those files only be made available with the written approval of the individual senior citizen. They changed that in the contract, and then they turned around and presented us an assurance that had the same old language that had been in the contract. So that would have put us between a rock and a hard place. We either honor that assurance to AAA and violate the Inspection of Public Records Act, or we comply with the Inspection of Public Records Act and don't honor the assurance to AAA. Those were two very clear ones. On those two items, the compromise that Steve was talking about is that they said, well, go ahead and leave the clause about an affirmative action program out. And so I've drafted a new version of the assurances leaving that out. And on the confidentiality requirement, I've put in a provision that it's subject to the requirements of the Inspection of Public Records Act. The last item that caused me concern was a paragraph that, by my reading, required us as part of our senior programs to serve as a contact point for all senior programs, whether we offered them or not in the county. For example, one thing was Alzheimer's programs. I don't know what kinds of Alzheimer's programs exist or don't exist in Taos County, but to require us after the fact to be the coordinating center point for all senior programs in the county is not a reasonable request. Now, when Steve and I spoke with them yesterday, they said, well, that wasn't the intention of that paragraph, that's just the way you're interpreting it. And they said the intention was just that your programs that you offer through the contracts with us don't duplicate other programs. And I said, fine, if we can say that in that clause, that that's all it's intended to do, then I can recommend it to the county commission. So I've put an additional paragraph in that clause saying it's not intended to require Taos County to do anything other than the programs we've contracted for. It's only intended to avoid duplication.
Now, Mr. Malone, Tri-State works with other programs that are managed by counties and municipalities, probably. Why are they making it so difficult?
I can't.
You would think that they would have a boilerplate contract or agreement with other entities that they would be able to follow. So
the only insight that I can give you, Mr. Chairman, is, I think I already alluded to this, but when we had that meeting, telephone conference yesterday, the comment from, I think it was from Jenny Martinez, is that her last name?
That's correct.
Yeah, from Jenny Martinez was, well, I guess the others just haven't read it as closely as you have. I mean, that's all I can say.
Yeah.
You know, you would hope that there would have been, but you know, just the idea that it would be in conflict with the Inspection of Public Records Act is strange. Now, what you have in the materials on your iPads is the original version that they presented, and I think I left it up at the desk. I'll pass out the revised version.
You have it in a folder? Tax and RAV, AAA? Yeah, assurances. You don't want to pass it out? No. Assurances?
Yeah.
Do you want me to pass it out to the commission?
Yeah.
And then I'll get one for the clerk also.
So I am recommending that we go ahead and sign these assurances with the modifications that I've made. And I do want to be clear, we've got no guarantee from them that they're going to accept that. They said, go ahead and draft it with the changes you propose. And so if you compare the one that Steve is passing out, I think it was paragraph 7 in the original was the paragraph on affirmative action. That has simply been removed and paragraphs have been renumbered. Paragraph 8, confidentiality, now has clause saying compliance with the Inspection of Public Records Act will be, take precedence over the confidentiality clause, and what was previously paragraph 11 is now paragraph 10, coordination, contains a final paragraph setting out that this is not intended to require us to institute additional programs. There are two other documents that I also want the Commission to approve, but they're not controversial. I'll go over those in just a second, but I think we should probably take them one by one. So on the assurances, I'm asking the Commission to approve the version that I've revised. We'll send it to AAA and hope that we don't get into a fight about this with them. I mean, it's like a bad joke dealing with a government agency. I hope we don't act like that when other people are dealing with us.
Okay, Commissioners, is there a motion?
So moved, and thank you for your good work. I can't imagine them balking at it with all that good reasoning, so we'll see.
Second.
Okay, Madam Clerk?
Yes. Yes.
Yes.
The other two documents are not changed. They're as they appear in your packets. There's and these are both documents that were just prepared by AAA with fill in the blanks. We went ahead and retyped them with the blanks filled in. One, for whatever reason, they want a resolution from this commission saying what it already said when it voted to approve the contracts, just authorizing in retrospect the signature from the chairman. And so the document that's entitled a resolution authorization simply recites that on June the 24th, the commission authorized the chairman to sign the contracts with AAA.
So moved.
Second.
Okay, Madam Clerk?
Yes.
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 And then finally, a commitment of local funds. Again, this was not in the contracts that we signed with them, but in talking to Mike and Leandro, this was in fact part of the negotiation with them about how this important project would be funded, and it did include a commitment on our part of $24,657 in matching funds from the county. And they wanted a signed commitment saying that we were committing those funds. Spoken to Leandro, and that amount is accounted for in the budget.
Move to approve.
Second.
Madam Clerk?
Yes.
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 Thank you.
Thank you, sir. Okay, the next item is it 8B?
8B.
8B. This is discussion, consideration, decisions regarding the following. Resolution 2014-32, resolution for the 2014 final quarter financial report year ending to June 30th of 2014. Ms. Trujillo, County Treasurer.
Again, good morning, Chairman, Commissioners. Before you, you have resolution number 2014-32, and this is a new type of requirement the DFA has that the Commission is given a copy, an actual copy of the quarter financial report, and you're able to view it prior to approving the budget. And I'm going to just go ahead and just read briefly the second whereas is, well, the first one. The governing board in and for the County of Taos, State of New Mexico, has developed a budget for fiscal year 2014-2015. And whereas the final quarterly report has been reviewed and approved to ensure the accuracy of the beginning balances used in the fiscal year 2015 budget. What this is saying is that in the final budget, you're working with actuals. So they're starting with the beginning balances, cash balances, as reflected in the financial reports as presented by the Treasurer's Office. Whereas it is hereby certified that the contents in this report are true and correct, to the best of our knowledge, and that this report depicts all funds for fiscal year 2014. Now therefore, let it be hereby resolved that the Board of County Commissioners, County of Taos, State of New Mexico hereby approves the final quarterly report for fiscal year 2014, hereinafter described as Attachment A, and respectfully request approval from the local government division of the Department of Finance and Administration. So this will be also sent over to them for finalization. So I present this to you for your trusting that you reviewed it and that it could be approved.
Any other recommendations, Mr. Malone?
Mr. Chairman, I have not reviewed this, but I've spoken with Susan about it, and it's an appropriate resolution.
Okay.
So moved, Mr. Chairman. Second.
Madam Clerk?
Yes.
Yes.
Yes. Okay, the next item is under Budget Matters, item 9. Discussion, consideration, decisions regarding the following Taos County Treasurer's Investment Committee report. Mrs. Trujillo?
And I believe that the information is okay. Just want to see how. The manager and we were having a discussion a little earlier, and again, I think it is so important that hearing the discussions and the dialogue that went on this morning, that financials should not be complicated, that it is our goal, I believe, in Taos County to keep things very, very simple and understandable to where the people in management and administration that are having to make decisions can understand them, and in a simplified manner, so that you're able to make the decisions that need to be made. And so hopefully, if at any point you have any questions within this presentation, that you will be free to ask. And the first one that you're going to see again is the graph that I provide for you every single month. And this is the one that is provided, this is the June 30th report, so it completes the picture of where the graph is at the end of the year. And it's the, it would be the, I would call it the goldenrod color of yellow at the very top. And on the June 30th, which is, again, at the very, very end, at the very top. So we, as you look at the picture, it ends very well. But on the second, would you go up to the other part?
Yeah.
The second slide then. I believe it would be the second slide. There. These are the numbers that represent this graph. And if you will look at the very bottom of fiscal year 13 and 14, well, I'd like to describe it as fiscal year 2014. If you look at the very, very end in June, in the June column, in the very corner, you will find that we ended the year with $5,672,623.30. And if I take that difference from last fiscal year, we're negative $768,779. And our required reserves, which were the 3/12ths, were $2,663,899. We had an excess or a remaining balance of $3,008,724.30. So we look into the consideration of our 4/12ths, which it would be $3,551,865, and there is a remaining balance of $2,120,758. And that would be what I would consider an unbudgeted cash balance. And I'd like to let you know that that is where normally the finance director and with your approval, recommends the temporary transfers out to the different funds as they're needed to for operations, and that's where they get them from the unbudgeted cash balance. The next one. Oh, any questions on this?
No questions yet, Commissioners?
And another point that just came to mind is that in discussing or talking about the transfers, there are transfers out that the finance director or that the finance department has made to other grants. So there's cash in other funds that would be part of this ending cash balance that have been loaned out by the commission. So I have prepared for you and this cash analysis, which is as of June 30th. And if you look at on the green portion, you will see that the revenues, and this is for the general fund, we ended June 30th, 2014 with $13,156,960.71. We were budgeted to receive $12,602,305. We brought in $554,656 in excess of our budget. And in the second row, we have our expenditures, and our expenditures were $9,655,626.48. We were budgeted to spend $10,704,891. We did not spend $1,049,265. And then the transfers in and out, we transferred out in and out $4,270,113.40. We were budgeted to transfer out $4,183,257 and in excess of $86,856. So if you calculate what the general fund total was at the end of the year, we had a deficit of $768,779,017, and our budget indicated that we had a deficit of $2,285,843, and so I believe that we did very well. And again, I'm going to make a note that I have included, because we've considered the public works and the detention center, the EMS, as governmental funds that are subsidized by the general fund. I included them at the cash balances. And so the cash balance in the Public Works Department is $256,385. Oh, I can't see that. $285,035. And there's always a match that is a 1/12 match every year, and this last year was $178,014. So if you subtract that balance would be $78,371.35. And then the detention center has a cash balance of $473,916.58, and the EMS has a cash balance of $175,836.56. So if you calculate all of that, we ended fiscal year 2014 with with a negative 40,400. Is that $674,054? And to me, that is very good. I believe Taos County, I'd say, ended the year very, very well. And when it was all said and done, it would have been $1,604,944, but to end with a negative 40,000. And again, I want to say that they're monies in other funds that would just make this 40,000 not even exist, because I don't know at this time if you know how much money is is in other funds as in total, but I believe it's probably a good amount, correct? But like I said, I was very pleased to see that ending cash balance. The next one is, any questions on this? Okay, the next one is the, okay, that would be the investment report. And I don't have that portion of it, but that is the current investment report and the monies that we have in there. And I'm going to go over here so I can. In that particular report, we have renewed renewed the $2 million, and but the other two investments are very current. Those are the investments that we have. I believe that if you recall the presentation that we had in the previous investment committee report, is that we moved monies into U.S. Bank, and we have left it in a general account. And with that general account, the monies in that general account, when the analysis are made of these monies, they help pay for our costs of the banking costs and the banking charges that allow us to handle our lockbox. And so in essence, by not investing the money outside, which the investment return is minimal, we are making very good use of our money by allowing the bank to form this type of analysis, and we're not charged for these charges. In fact, it's a very good strategy that the bank has offered to Taos County and that we're utilizing. The next one.
Excuse me, Mr. Chairman. So the 2% we get from U.S. Bank, that's net of fees, or are there fees that come out of that?
This particular one is an investment. The other portion of the monies that we have are in the general account, and those are the ones that are used for the analysis.
So the 2% is net to Taos County?
Yes. Okay. The next item that you have before you is the detail of receipts. And I have presented for you the property taxes. And if you can see here in the last four columns, those are the ones that I'm going to be looking at, you will see that the year-to-date cash receipts that we received, and this year in property tax we received $9,302,934.45. The budget, we budgeted $9,293,457, and it was the collection rate was as of 90% of the valuation data, and so that was in excess of $9,477.45 over budget. So we collected basically 100% of the 90% of the 90% that was budgeted. And the property tax prior year, the budget was $725,000. What was collected was $821,329.68, which was in excess of budget of $96,329.68, 13% over budget. And the penalty and interest that was kept here in Taos County, the budget was $250,000. What we received was $336,790.76 and an excess of $86,790.76. We're over budget by 35%.
Mr. Chairman, just going back to the investments again, has there been a careful analysis as to whether or not there's any funds in addition to the $2 million that could be utilized at the higher rate, that could be invested at the higher rate?
We will look at those. I'm going to be having a meeting, calling a meeting shortly with the investment committee, and we will look at that and as a whole, and taking any recommendation and considerations of any future investments. And on this property tax, the comments that I would like to make is that the Treasurer's Department has really targeted the prior year, the delinquent taxes, and by working those, we're keeping the interest and penalties here in Taos County. So that really makes a difference. So in the property taxes alone, there was an excess of $192,597 and over budget. So if you look at this, if you go back and you look at the end of the year analysis and you look at the $554,656 that we were over budget, this is part of that money. And I believe the other part of that money would be the PILT money. We came in excess, I believe, of 200 and some thousand, correct? 150,000? 150,000. So all of that, these monies make up that excess budget of $554,000. So like I said, this is kind of an area that I've really targeted, and we're really working hard on that. The next one is, and this is the outstanding tax report, and this is all-inclusive. This is before the distribution to the entities, and this is the real property, includes mobile homes, personal property, and livestock. This is in its entirety for the last 3 years, the 2012, 2011, and 2010. There is a quarterly, the quarterly difference from March to June. What was collected in excess, the difference was $383,877.48. And from the beginning of the fiscal year, which is July to June, there has been $1,301,615. So to me, this is going to, now that I have an ability to numbers to compare to, I will be giving you that every year so it won't be just the fiscal year from July to June. It'll be, and I'm hoping to see an improvement every single year. And so this just does not benefit Taos County, us. It benefits the other entities, how well we focus on our delinquent taxes. And the next one is, and this is a detail. This is a detail of the gross receipts. And I think if you looked at these, at the very end, there's the excess dollar amounts of each of the increments and each of the enactments that of the distribution of, or that would make up the 7.125% that is collected in GRTs by Taos County. And we're in that, in the general fund, if you look at the very top, the general fund, which 3/4 of the 1/16 goes in there, and that is, the excess is 20%. And in the county health care fund, which is the 50% of the third 1/8, which is equivalent to 1/16, there's 13% over the budget. And the next one is the 103, and that's where the excess from the fund for 420, from the excess of the loans, and there was an excess of 39%. And the environmental GRT, that is, the money goes into the solid waste. There was an excess of 33%, and that's the 1/8 that goes into the environmental GRT. The next one is the public works. That's the 1/4 of the 1/16. That 1/4 goes into the public works, and 3/4 goes into the general fund. So that makes up the that particular 1/16. And there was 11% over on that particular one. And then on the indigent that was discussed earlier, and you see in its entirety that we received $1,092,981.43. And there's with the 1/8 plus the additional what is it? It's the second 1/8 plus 50% of the third 1/8. There was an excess in that particular category of 7%. And then that's that where it's highlighted in a darker yellow, that's the Medicaid intercept that automatically goes to pay for the Medicaid program in Taos County, and that's 6.9% over. But in total, there is a 9% increase in that fund in GRT's over budget. The fire excise, which is 1/4 of 1/4 percent, there you have 29% over. And the jail, the jail received an excess of the correction tax, and it received 46% over. And the next one is the USDA complex loan, and that gets, you have the first 1/8 of the GRTs dedicated to that loan, and there was an excess of 8%. Then you have the complex fund, which is a 420, and that's a combination of the 1/4 capital outlay, 1/16 of the correction, and 1/16 of the infrastructure. And we received, that it's intercepts, so it records the intercept, so it's 100%. It only takes what is intercepted by the loan. And then we have the equalization intercept, which goes in there also of 101,870, and the excess of that goes into the 103. And then in the very end, now we have the county educational GRT, which was approved, I believe, in February, and that is 50% of the of 1% GRT, and it came in at 98.1. So that is doing very well also, because it also took into consideration that there was additional what they call mandatory redemptions in that. So there was excess, and it's applied to the principal on that loan. So this is your GRT report, and I believe that we ended the year very well in our GRTs. Any questions?
So that's indicative that the economy is continuing to get better?
I believe so. I was, and a good indication is looking at, and I believe it was discussed that the 1/8 is, this is the first time I've seen it go over the 800,000. And that initial, the first 1/8, probably in 2008, it was generating 1.4 million. So it took a hit. We were budgeting 700,000, and then last year I believe we budgeted something like 750,000 in some of the funds that yes, if you see that USDA complex loan, we budgeted 750,000. And 812,955 came in, and that's what came into the Indigent Fund, $812,000. So that's what that 1/8 is generating. So I mean, it's I would say it's going up maybe steadily, but it's going up because I believe in the last 2 years it had been just very, very flat. Correct?
Mr. Chairman. So the 1/8 is about 800,000 now. What was it at its peak, did you say?
1.4.
Really?
Yes.
We got 1.4 out of a 1/8 during like 2007 and...
Yes. It would have, and again, I don't know if how long it would take to get there, but just the fact that it's increasing is a good indication of the economy.
We were building a lot of houses back then and very few now, I'd say.
Maybe then that too. Any questions?
As far as the airport, the town airport, when is that supposed to start getting built?
That, I have no idea.
Last time I asked the mayor, he said this summer, late this summer.
Late this summer, and so we'll start to see some of that as well?
Hopefully, because we've already promised it to the town, so.
And like I said, to me, when I look at all of these are all revenues. And revenues are very important to consider because it tells you what it is that you can spend. And this is a very good way that the finance department at this point in time that they're working with actuals, they can either increase or decrease the expenditures based on the actuals. And then maybe it's kind of hard when you're doing trend analysis with a type of economy, and then with even the mine closing. I don't know what kind of an impact it's going to have on Taos County, but I'm sure it will, and that's going to be seen in the numbers. They will speak for themselves. And like I said, I look at these numbers very carefully. I've studied them in the past, and I was in my discussion or in the conversation that we had earlier with the manager. To me, like I said, it's very important that if I can give you anything, or if you have any questions as to what you want to understand better, or to make some kind of look at something differently, please let me know, because I think that that is the only way that you can make any educated decisions that you have to make when it comes to the expenditures in Taos County.
Thank you,
So
Susan.
thank you very much.
Thank you very much.
Thank you.
Thanks to the assessor's office, too.
We're on item 9B, I believe, discussion, consideration, decision regarding the following. This is DFA resolution number 2014-2015 fiscal year resolution requesting to amend the preliminary budget for 2015. Mr. Cordova?
Mr. Chairman, Commissioners, yes, as it states, we're actually doing one last resolution to amend the preliminary budget before we adopt the final budget today. The reason for this is that our senior programs, as it was alluded to earlier, have not received the funding we were anticipating as startup costs. So the Commission's already approved a $35,000 transfer over in the previous meeting in order to meet payroll and liabilities. Today, we're asking for another $19,657 in temp loan, a transfer over. That will fulfill the total amount that was in the contracts and the budgets for local match. That amount was just over $54,000. The county committed $24,000 of that. The rest of it comes from other donations, other contributions from other local governments, and any income or revenue generated from the program in terms of meals they charge for, that kind of stuff. So this transfer here will take us to the contractual obligation that Taos County has at this time. And we hope that it'll get us through this payroll at the end of the week. Well, pay period ends on August 1st. We'll pay next Friday. We'll make the payment for payroll. We did get some upfront money in the previous fiscal year for the transition, $35,000. We have an outstanding reimbursement of $14,000. if we can use that when it comes in, if we haven't received any other funds, we may use that. That should get us through the payroll on 8/22, which is both payrolls for the month. It'll be very, very tight. And it's also taking into account we're not paying all of our payables. We're only paying our payroll at this time because we don't have all the cash that we need. So we're pushing off some of the payables until we have the money we need. So they have put us into quite a fiscal crunch, and I think the most unfortunate part is we weren't able to properly plan for it without them telling us that this was going to come. They alluded to a different opportunity. So
as far as the payables are concerned, what is that total and what does it include?
Well, they've been real light up until recently, so it will include things like the food that they're purchasing now, all of their utilities, their bills, every other operating cost. So like I said, it had been light up until recently, but as they've been operating about a month now. And of course, you're going to incur payables and liabilities, and our vendors need to get paid as much as our employees need to get paid, but we've kind of prioritized payroll over payables, and I hate that we even had to make that choice.
Yeah. Mr. Chairman, Commissioners, I just want to reiterate for Commissioner Romero, or Chairman Romero, that because you sit on that board at AAA, if this can be taken back, because it's really put Taos County in a difficult position. We're trying to do what's the best and the right thing to do for our senior citizens, but they just have not fulfilled their end of the agreement at this point, and it's really put us in a bad situation.
Also, I will communicate it to Representative Gonzalez. He's also on the executive.
I would appreciate it.
Yes, please. And I'd like to thank our Treasurer's Office for helping us work through this. It was very trying, and it was a difficult situation, and they've been great partners in helping us find solutions.
Yeah. Thank you.
And I do recommend approval of this TFA resolution.
So moved.
I will go ahead and second, Madam Clerk.
Yes.
Yes.
Yes. Okay, we'll move on to item 9C then. This is discussion, consideration, decisions regarding the following DFA resolution number 4, 2014-2015 fiscal year. Resolution requesting to adopt the final budget for fiscal year 2015. Mr. Cordova?
Mr. Chairman, Commissioners, I think I'm going to actually do letter D first, so that you can have the presentation before you have to vote on it. I think we kind of mixed up so I'll ask you to vote on the resolution number 4 after our budget presentation.
Mr. Chairman, Commission, I'm not sure if the assessor wanted to address the commission prior to that, so if after we do item D, maybe the assessor could take a couple of minutes out of the commissioner's time.
Okay.
So looking at our final budget, first of all, let's note that there wasn't major changes from the preliminary to the final. The biggest change is probably that we had a little bit more revenue to play with. In the preliminary budget, we estimated an 87% collection rate. We went ahead and went up to an 89% collection rate. Some of the impacts that we had to face, fiscal year 15, medical premiums increased again by 10%. We had a mandatory 0.4% para-employer increase. We took the PILT out of our revenues in general fund. I mentioned the property tax collection rate. We did move up to 89 from the preliminary, but it's down 1% from last year where we collected 90%. And that was just on the side of being conservative. We did collect right at the 90% last year, but our climate has changed, and we wanted to make sure that we didn't get caught over budgeting. As the treasurer had mentioned, our major funds have sufficient cash balance to start the year. It's something we did last year. We did it again this year. We made cash transfers prior to the end of the year in order for EMS, detention, the public works to have the necessary cash they would need to operate through the first quarter. Last year's budget, as has been mentioned, for the general fund was overspent by $768,000, and also, as was mentioned, $420,000 approximately was due to temporary loans. What we're not going to do this year is transfer the entire amount of a temporary loan right up front. If there's a request for a temporary loan on, say, a grant, we will transfer cash as needed and begin the reimbursement process on those grants to get the cash back in, and hopefully the general fund won't have to sustain an entire $80,000 grant. Just as an example, we'll just transfer what's needed, and then that way we'll have more money left in the general fund. We won't have to worry about transferring it back. And we'll move on from there. So this is basically a quick snapshot of last year's final budget to actuals. And the treasurer kind of talked about all this in her report, but you'll see we budgeted revenues of $12,586,000. We actually received revenues of $13,156,960. We budgeted transfers out that all were less than that. We were able to save money in public works, detention, EMS. The grant match was the same, and the capital enhancement was a little less. And then budgeted transfers in. This is where we kind of got caught with the temp loans. We did expect, as the temp loans came in and were requested throughout the year, we expected to be able to transfer more back by the end of the year, and we weren't able to do that. We did what we could, and we are continuing seeking reimbursement, and as soon as that money comes in, we will get it back to the general fund. But the bottom line being, the budget expenditures were less than actual expenditures were 9.6 million, so the difference was that 768,000 in the red. We budgeted 2.2 million in the red. So I agree with the treasurer, we did pretty well in terms of not hitting the full budget and getting that far, but we did spend more than we did the previous year. The previous year we didn't have a deficit at all, and this year we did. And so it made this budget year more difficult on top of all of that. So here is a comparison of last year's budgeted amount to this year's budgeted amount. So you can kind of look at apples to apples. As you see, budgeted revenues are less in this year. We're down to 11,420,000. We took PILT out. That's the biggest thing that we could have done to lower the revenues, is we took out the PILT. We also were able to lower some of our transfers out. We didn't budget PILT in the general fund, but we did budget PILT. And so there are a few cash transfers we transferred out of the PILT fund, which will be the $399 at the end of the year. So if we do receive the PILT, we'll make sure at the end of next budget year, we'll make sure all our other funds have the cash balances they need, and we'll take that money from the PILT instead of the general fund.
What did we receive this year?
We received 1.65, wow, I believe, and we budgeted 1.48, so it was about 170,000 over.
Yeah. So from now on, like you said, we're not going to budget it?
We're going to budget it within our capital enhancement as a revenue, and because of the timing of it, we didn't budget expenditures to match this year. Next year, if it comes through, we receive the money, you'll have the opportunity to budget capital expenditures to match that, and that'll be things like roads, fleet purchases, the needs, the one-time expenses and needs of the county. But you can see at the bottom line of that, the difference from last year to this year, we're still in the red. We still have a $1.8 million deficit. We took 1.48 out of the budget in revenue. We cut the rest in expense side. This is going to be a tighter budget than last year. The 2.2 difference last year, we knew that we had room in there. We have some room in this budget, but it's not going to be nearly as much, and we're going to have to really watch it a lot closer than we did even last year, and pray for PILT. This is going to be kind of a transition year.
And as far as NACO, the Association of Counties, is concerned, they're wanting to push Congress to make it a permanent fund, the PILT funding, so that it's not something that we need to have to be worrying about on a yearly basis.
Mr. Chair, I believe if it became permanent, I probably would get the director to go ahead and put it back in the general fund as a permanent revenue. So I think that would be a good thing for everybody. I would welcome that.
The other good thing is that that amount keeps going up for Taos County. Despite all of the bad news that we get about it on a yearly basis, and when Congress is getting ready to make the decision on it in March, it seems like that amount is still continuing to go up for us, which is good.
It is, and I think the addition of the Rio Grande del Norte would probably increase that as well, because it's more public lands within our county.
Yeah.
The next slide is just a quick pie chart of our revenues. As you can see, by taking out PILT, it increases the property tax portion up to 92%. And so we do rely very heavily on property tax. That is our biggest revenue. And here are the expenditures, general fund expenditures broken down by department. This has remained pretty steady over time and didn't change much from the preliminary. So here to take a look at some of the general fund over time, we can see a 3-year comparison. Obviously, fiscal year 15 is budgeted amounts. I think the biggest difference is our transfers in and out. The net is a lot smaller. We're only budgeting the net transfer out of 2.987. So that's where we were able to cut a lot of our expenditures. Total expenditures in general still went up. And as long as we have employees and these mandates for healthcare and para and retiree health, I read an article this morning, retiree health is going to go to the legislature this year to push an increase for next year. So we may look at another mandatory statutory increase next year. So I can't see those expenditures ever really going down as long as we have the size of personnel that we do within the county.
How many staff do we have now?
We're up to close to 300 right now. That includes commissioners, and it also includes temporary staff.
Okay. Are we, where are we as far as staff or payroll or the amount of people compared to the schools, what used to be the mine?
I will do some research and follow up with you on that. I wasn't anticipating that question. So, okay. Overall, though, I can say that if we bring in these programs, we may have cut a few staff over time, but we bring in more programs that add the numbers, and that's kind of where we.
After we bring in 911, we'll probably be the second largest employer. I'm thinking our school district.
Wow.
In the hospital,
yeah,
we'll be in the top 3.
Yeah. Thank you.
Our Public Works Department, it's been basically flat over time, which unfortunately they have a lot more needs than they have the revenues. However, we have done a pretty good job of managing their expenditures, it seems like, and we have put in a little less in transfers out of the general fund. This is one of the funds that will receive a capital enhancement transfer if the PILT comes through. They'll get some money at the end of the year from that. But the detention fund has been a fund that, through reorganization over the years, actually been able to save some money. And this is one that needed to. It was a big drain on our general fund, and it's come a long way. Once again, you can see the budgeted transfers out are less than 2 years ago, and we hope that they'll come in even less than that. That does, once again, you see the ending cash balance at $1. We're anticipating expending it all the way down, but if the PILT came through, we would increase that cash transfer from the PILT money and give that a substantial balance. And the solid waste, this is another fund that has done well in the past. However, we're getting to a point where we really do need to make a decision going forward on the rates that we charge our constituents. As we remember, the landfill increased the rates that they charge us to dump our tonnage in the landfill. We have yet to increase the rates. We brought it to you in the work study for the preliminary to get you guys to understand the need, but it's on a finicky cycle. They kind of bill out the same as our fiscal year. So in order to have changed them at this time, it would have been a real complication for the actual billing that they were doing. They were preparing their billing at the same time we're talking about rate increases. So this will come back to you through the budget year to affect next year's budget, but we will need to look and take action on something in terms of rates or really cut expenditures, which is going to be hard to do because they operate very lean as it is. They're a good department in terms of their efficiencies, but you can see that the ending cash based on this budget basically zeroes out, and so we do need to address it at some point and look at how we're going to continue to self-fund that enterprise fund without general fund money. And then the EMS also has been doing a good job of balancing itself out, but its expenditures also are going up and its needs are going up. We are going to have to replace a couple vehicles this year. We do get some money from the hospital this year, but beyond what they give us, we're going to also have to put some money in from the fire excise monies in order to get them new equipment, new vehicles.
And also with the road department, just hearing from our interim road foreman, superintendent, that with these recent flood issues that we've had, we really don't have the best equipment to handle that type of situation. And it's happening more often than not. So
we do have
something else that we need to address really soon.
Mr. Chairman, we have the ability to at least retire a couple leases coming up, and that gives us the opportunity to replace a few pieces. But as you mentioned, the need is far greater than our ability to service the need. And that concludes the very quick, brief synopsis of the budget. We'll go ahead and get into the general fund, and we can move somewhat quickly through it. If you have any specific questions, slow me down and ask me questions. I don't mind you stopping me for any reason, but this is just another pie chart. Here's the actual numbers, and the biggest change between preliminary and final, as I mentioned, was in the revenues. We increased property tax revenue up to the 89% collection rate, which increased it overall, I believe, almost $120,000. We were also able to make a few more cuts from preliminary to final, and so the net difference between the preliminary and the final is about $150,000 less. So we have a gap now of about $1.8 million. The preliminary I gave you was about $1.95 million. So we did even cut a little bit more. How did we cut? I'm sure that's a big question. How did we cut? Well, we took one-time expenses out of the general fund, a lot of things that are non-reoccurring. This year's general fund is pretty much personnel and operating, what it takes to turn on the lights in the morning and do the work that the good employees of Taos County have to do, which also makes it difficult to cut any further in the future without affecting people. So yeah, it was good to cut. We were able to do some cuts. And it should also be mentioned that the largest percentage of general fund cuts were from the commission, from the manager. These are one-time things that were plugged into your budgets that we've now either moved or eliminated some of the expenses. And so where did we move them? We moved them to the 399, where if the PILT comes through the following year, we can begin to explore those expenses again. The PILT does, the 399 does have some funds in order to do some of the projects that have been identified, and there are things that we've talked about that will get done, land purchases, vehicle purchases, Amalia Community Center, things like that where priorities are still in there for this year, just not as much as we would like to. And it doesn't address every need that we have. Would you like me to go through each fund individually on the general fund? Do you have any questions specifically, or would you like me to go on to the governmental funds?
Commissioners, what's the choice?
We can move on.
We're operating on 0 calories, and so
I get it. I'm trying to.
When you mention pie charts, it makes us even hungrier.
I didn't say apple pie. This is our Public Works Fund. Like I said, it's pretty much flat from last year. The needs that are present at the Public Works aren't fully addressed within this budget, but the previous Public Works Director gave you some projects that he had outlined with monies that are available, and hopefully those projects can still be fulfilled in this year. Our detention fund, as I mentioned, has decreased. Overall, we've managed to decrease personnel numbers somewhat, as well as operating somewhat. However, it was reorganization, and it was a lot of work on both management and the staff over there. The staff over there has worked really hard to, come in line with the changes and do their best to accept them so that they can have what they need to operate.
But as far as the cuts on detention staff, is that a good thing? Is it a...
Numbers have increased, actual amounts have decreased. So we've increased the number of staff. I think we've even increased salary for incoming, and we've tried to balance out people correctly. It was just by reorganizing it the way that they did in a real in-depth approach, we were able to save dollars.
Good.
And let the county manager expand on that if he has anything to say, because I think it was a lot of his initiative and
Well, Mr. Chairman, Commissioners, we basically took out upper management as much as we could and consolidated and streamlined that. We did also, as the finance director stated, we're able to take staff up to a $12.55 an hour pay grade so that we could try to maintain staff, keep staff once they were trained here, and so that they wouldn't go to other facilities. And so we actually were able to increase staff, increase a little bit of their overtime in order to make sure that we're providing the correct service, but we cut in other areas in order to do that. And it was probably one of the biggest agencies that we had the biggest cuts in. We still have a long ways to go at the detention center, but staff is moving along, the administration is moving along, and we're continuing to move forward with that.
Thank you.
Next, we'll talk a little bit about the solid waste. Just because of what I mentioned, we do need to look at their revenues. There are certain cases with some of our disabled ratepayers where we're paying more to dump than they pay us. And that is a very simple equation. We're losing money right off the bat. And if we don't at least make ourselves whole, we're going to end up supplementing the solid waste. And you know, I understand it's always difficult to raise rates, raise taxes, raise any expense to our constituents, but I think the fact that we pay more to dump than they pay, it would be cheaper for us if they went straight to the landfill on some of those $25 punch cards. There's a lot of options. We're going to try and explore everything that we can, maybe lowering the tonnage that we allow them to dump so we won't have to raise the rate as much. There's different options that we can bring to you, and by postponing it a little bit, not making it a final budget decision, it gives you guys a little more time to look at it comprehensively. And we will come back for another work study, hopefully specifically on solid waste and fees. And then the EMS, as I mentioned, they plan to replace at least 2, I think maybe even 3 of their vehicles this year, or maybe not replace the entire thing, do a remount similar to the approach he took last year, which got basically a brand new vehicle at significant savings over purchasing a complete new vehicle. So he remounted his box on a new chassis, and I think that's the approach that Mr. Gonzalez is going to take again this year. But other than that, operations have been flat. They've done a good job from the previous year of cutting their costs. And I think increasing service, that's kind of my opinion. I see those buses everywhere. I can't believe we only have the few we have because they're everywhere. I think we have double the amount just because they're always moving. So.
And the collection rate for them has also been.
That has also increased. And a lot of that had to do with the training that the administrative staff went to in the springtime for coding and billing. A lot of changes occurred, and them having the knowledge about those changes helped us, and we capture as much as we can capture on every bill. So after those main few funds, I wanted you to look at the 103, which is our admin judicial complex fund. This is where we collect the excess of our GRT. There's only a very small amount of GRT that goes into the general fund. The rest of our GRT is either pledged for loans, as you know, or the excess goes into this fund. This was a fund that did a lot better than than we anticipated or than we budgeted for. This is also the fund where we anticipate paying for our Motorola equipment for the 911. And then we also have a line item in there for some land acquisition. And I think it's kind of a buffer just in case, but this is one of those where we do have a little bit of increase. So it's not all gloom and doom. This is a good. However, I will mention that for this year's projection on GRT, we are going on a flat projection. We're not anticipating any increase. I don't want to anticipate a decrease either. However, I do worry about the impacts of the Chevron mine closure. I worry about all of those impacts, and the fact that this is a high watermark for the last 5 years, I didn't want to. Very conservative. Let's just go flat, and then we can monitor it real closely, and if we need to at mid-year and if things look down, we'll come back and let you know immediately that our revenues aren't what we anticipated them to be.
With regards to Chevron, when do we foresee starting to see the lower GRT and all of that happening?
It's so hard to say. First of all, GRTs, as you know, are reported kind of 2 months back. So basically, if this month's will get reported next month, paid 2 months later, and we'll receive it 2 months after the fact, essentially. So we're not seeing this summer's revenue or GRTs yet. It will be hard to really see until probably next year at this time. Okay. But I'm just anticipating that it's got to affect it. It has to.
Ms. Vihil?
Concerning the mine, I just wanted to remind everyone that because it is considered maintenance, what it will do is it will actually crank up the tax rate. So revenues are going to still come in. We're going to see our tax base kind of fluctuate in that area, but the tax rate will offset it. Unfortunately, then the taxpayers carry that burden. Yeah. And so, you know, when everyone says we may lose revenues, well, obviously, indirectly, if the taxpayers don't pay, you're going to lose revenues. You could, but that tax rate is actually going to offset it.
And that'll be from the reduced value of the property because it's no longer income property.
That is correct.
So, but it won't affect our budget, but it will affect
the property owners,
I'm
certainly.
I'm not
going to be here, but
oh, that's right.
but I will say that it will affect, yes, definitely. However, one last thought. And so that obviously is very important for the assessor's office to drive, the non-residential and to make sure that we get everything we can, that our commercial is up to date, because that will offset also, that'll drive the tax rate down so we can sort of balance it. That's what we're intending on doing, right?
Chairman, Commissioners, you had also mentioned the GRT. The other thing we got to keep in mind is the construction going on at the mine site, as well as the tailings for the closeout of the mine. So those contractors will be paying gross receipts tax back to the county. The tailing site, the county will get some in the village of Cuesta. So we need to work with Chevron in identifying how their construction is going to be taking place at the mine site, and then we could look at those tax dollars coming in.
And for how long?
And for how long?
Brent, what's happening? No movement at the mine. I've noticed that the contractors, nothing happening.
Chairman, Commissioner Sanchez, I haven't heard of any movement also. I know they're still working on their closeout plans with the Chevron Mining will get replaced by another division of Chevron called EMC. That EMC division of Chevron Corporate will be the one responsible for closing out the mine, and they'll start operations in January. But the village of Cuesta has not seen anything of projected construction schedules, and I think we would be happy to share those with the county as well when those become available to us.
Is Rust Remedial moving out?
I've heard that Rust is moving out because they were there for part of the expansion. There's another company,
Intact,
that I guess will be responsible for the closeout of the mine. But the expansion that everybody had heard about, some of the couple of those contractors are pulling out, and they'll go to another company called Intact that will close down the mine.
Thank you, Brent.
And on the whole subject of the mine, that's also part of the reason we went with the 89% collection rate versus the 90%. Just being conservative again. We do have to worry about our collections. The fund that's currently being shown is a complex construction fund. It's the 34-1, which is the leftover money from this complex. Most of that money is earmarked for buildings, and a lot of it will be used for the E911, the remodel of the sheriff's across the street and the new 911. There's still money in there for litigation and judgment, for outstanding litigation within the fund itself. But for the most part, that fund may get depleted by the end of this project, or pretty close to it. There's also something to note is a lot of the little funds you've seen in the past, we've worked really hard to actually clean up and so it doesn't seem like you see as much this year. There was a lot of detail that we were trying to just clean up, close them out, transfer any small balances back to the general fund, and just not give you as much to have to go through. So if there's anything else you'd like to specifically take a look at, I'd be more than happy to show it to you. As I mentioned, we went over a lot of the detail in the preliminary, and in our work study, not much has changed other than the little bit of revenue increases and a few more expenditure cuts. There's still a balance, I'm sorry, and I'll just mention real quickly, there's still a cash balance beyond our required reserves of about 1.2 million, which is really close to what we had last year. And I went ahead and allocated it the same way we did last year, predetermined, you know, the 10% for planning roads, and that way, so that you can basically get an idea that how the unbudgeted cash is being represented.
Right.
That was my question, unbudgeted cash. Thank you.
Yeah, I'm sorry I didn't pull that up, but that same Form S5 looks very similar to last year. It's the same allocation.
Okay. Anyone? Any other questions or comments? Thank you to all the elected officials that have participated in this. Ms. Phil, go ahead.
Pass something out here. Good afternoon, and I don't know if you remember, I reserved the right to come at some point concerning the budget, and I believe you all thought I was going to be very quiet this year, huh? And so, I actually was hoping that I wouldn't have to come before you, and I'm going to invite our incoming county assessor, Abel Montoya, come January. I think it's a moment to remember, because I don't know if any outgoing and incoming assessors ever stood side by side, in attempts to do what we're going to ask of you today. However, I want to give you a little bit of a history before we go forward. This memo that you see in front of you, though, is dated July 24th, but it did come as a result of a preliminary meeting with our county manager and with the finance director. I had stated to them a couple of concerns. We talked about additional staff that I thought we needed, but knowing very well that we had a tight budget, I was not going to come forward at this time requesting those additional staff. More so because I also remember last year that we waited more towards the end of the year to make sure that the monies were available. So I reserve that right. And however, I did mention a couple of areas that were concerning some inequities within the department, and also some merit increases that I thought were very important, excuse me, and that I'd like to see happen. However, and I guess I should back up. The response I received was very, very positive. I will say that I was very pleased that Steve and Leandro listened to me. They were very open about my concerns. And I had pointed out to them that there was some savings within, some savings within the budget, the assessor's main budget, simply because there had been some vacated positions that we couldn't fill at the higher level, and so the incoming also savings from the time in which you have to post and you get someone in, and but I had expressed these concerns, and so they were very cooperative to leave that monies in there. We had also talked about moving some money, some monies, or how do I want to say it, have the 1% take care of some of the costs that that could be moved over from the general to the 1%. And so those were some of the discussions that we had. I had a second discussion with Leandro, and this was just recently, and we talked about the merit increases. we talked about leaving some of the monies there for the incoming assessor. I understand that it's very important to do so. And so I had talked to Abel Montoya, and I had expressed to him, this is the monies that's in there, and these are the monies that I believe we can pick up from the 1%, leaving us some additional monies. And that's what you see, what you have in front of you is my memo to Steve and Brent Leandro. Attached is a breakdown of where these monies are available. And you know, I have to tell you, one of the hardest things, and I thought it was going to be exciting to be able to give merit increases, but as I sat and looked at the entire staff, I could not choose and pick, you know, who contributed more or who worked above and beyond. I really felt that it was a joint effort. It took the entire office, and as I've explained in this memo, that even during the times when the economy was bad, the assessor's office always kept it going. Tax base either remained stable, or in this case, this year, it has increased. And so I believe that everyone in the assessor's office is entitled to a merit increase. It's in the bargaining agreement. There is a process in place. However, that process has not been laid out. And as you all may have been at one of the previous meetings, I've talked about, you know, having the process in place so that we could determine these merit increases. That has not transpired yet, and so, you know, I feel that it's certainly not our fault, and I've been an advocate for my employees since the day I walked in. But at this time, I'd like to share this savings and well-deserved merit increase with the entire staff, and I'm talking about the full-time, because certainly we're unable to do anything with the temps. But they did contribute, and it does state in this memo. I certainly will turn it over to Abel.
Ms. Fahil, this list represents the all of the full-time
That is
employees of your
correct.
office?
Yes.
Okay.
Yes. So with that being said, I certainly thought that it would be best to team up with Abel, and he can speak for himself. We believe going forward, and obviously revenues from the assessor's office are very important. I want the assessor staff to know that their hard work has been seen, and I am known for pushing, and I do push very hard because it's very important to keep these revenues going, but they've proven they can handle it and that they can do this. And so I think it's time to reward them. And we're not asking for any additional monies. We've found it within our budget. It's not going to in any way affect the general fund any more than.
So this is for fiscal year 2015. Then of course for 2016 you'd have to do the same, because obviously you can't back and deduct those amounts. It's from here on out.
Yes, but once again, we didn't ask for an increase in the assessor's budget. It was found within the savings, and so, you know, it would have, if we wouldn't be doing this, it would have gone back into the general fund.
Yeah. Okay.
So it was already there.
Thank you very much.
Abel, would you like to?
Abel, hold on a second, Ms. Paras.
Abel, they're waiting for you. I'm sorry.
Members of the commission, first of all, I'd like to thank Darlene for involving me in letting me know what's going on. She didn't have to, but we've been working together, and I see her points, and I agree with what we're trying to do here.
Thank you, Mr. Abel.
I just had a question. Abel, do you anticipate any changes going forward? Any significant changes going forward? It's a pretty difficult question, actually, but if you do, and you could share them with us, I'd appreciate it. In terms of
what kind of changes?
Oh, just in terms of procedures within the assessor's office?
No, I think that's pretty much the way I want it running. I'm not planning on making any changes in employees, or I believe in the staff we have, and I don't see any major changes.
Great.
To keep on going. forward.
Abel and I do agree that this would be a boost to our staff, and it's well needed, very deserved, and this will certainly, I think, help going forward as well to keep on, so they'll know that their hard work going forward is not going to be in vain.
Okay. Commissioner Sanchez?
Yes, Mr. Chairman, Commissioners, Darlene, I respect that, it's good for all employees, but I've got a concern, that merit increase is good. I would like to help the rest of the county employees, because, if you give one, you're going to have a morale problem because they're going to get upset. I'm all in full agreement, but I would like to give across the board to everybody if we could. I don't know if we can, but that's where I'm thinking.
If I could respond to that, and I totally respect that, thank you. I understand what you're saying, but I can only stand here for the assessor's office. This is a merit increase. I know what my staff has done. I don't know if everyone throughout Taos County deserves a merit increase. I couldn't tell you that, but I can tell you as the elected official, the one that drives these people every day, and I know what their potentials are. Certainly, I can tell you that they go above and beyond, and that is why we are in the way of numbers positive. And that's all I can do, but it is a merit increase. I understand there are many that probably deserve, but I cannot. And I know many have stood here in front of you, other departments with reclassifications, and certainly I'm not asking to reclassify. I guess that would be another approach that would certainly increase, but I don't see the need. A merit increase it's in the bargaining agreement.
And I certainly appreciate the fact that as an elected official, you are standing up for the employees in your office, and that you're willing to do this for them. I certainly appreciate that.
Thank you. They deserve it. They really do.
I know we got some other department heads here that would probably like to get up and say something.
And there's someone in the back dying to speak. Go ahead, Becky.
Commissioner?
Go ahead and come forward. Introduce yourself.
Rebecca Parras Mondragon, President of Local 1193 for Taos County. Commissioners, manager, elected officials, and members. I commend Darlene and Abel. As a union president for Taos County union eligible employees, we're in negotiations at this point, and we're the sole bargaining unit for the employees. There are very many departments. There are the assessors, the treasurers, the clerk, who are also very concerned about their employees. We have employees throughout all the departments in the county, and we're working and trying to negotiate for all of them. Not one employee is better than another. Everybody has their own merit, and even though there is a merit increase, it has to go through a process. The raises are bargained for all union eligible, and that's where we're at the time. No, we're not taking anything away from Darlene, trying to get our employees the raises. I mean, after 8 years, I'm commend her. But for now, we're in negotiations, and that's where it stands, and we're the sole bargaining unit for the employees. Thank you.
Mr. Chairman.
Okay.
And also, this weekend, I was approached by the adult detention, about a raise. So that's why I'm bringing this up. There's others out there that would like to get a raise. Able to get a raise here in January, right?
There you go, Abe. For the record,
I just want to let people, and I respect Darlene and Abel for what they want to do.
I do too.
And I'm just talking about the others that would like to have a raise also,
And with all due respect, I appreciate them trying to come forth for their employees. And just to commend Mr. Archuleta, the employees from the ADC did get that comparable, and it should be happening anytime now, Mr. Cordova. So in the new budget. So until their bargaining negotiations are over, I don't think that we should be discussing any type of raises for anybody until that process has been seen based on the contract. Thank you.
I just wanted to remind everyone, I'm not asking for a cost of living, it's a merit increase. And I understand union negotiates for the employees, but as an elected official, I think I'm the only one that can come forward for a merit increase. That's different. That's totally different. I don't want that to be confused with the type of increase that union negotiates for. I just want to remind people of that.
Okay. Ms. Becky? I can see where this is going to turn into a nice little match again.
Without arguing or anything, just so you know, a merit increase is separate from the negotiating amounts, and that goes before a committee. So, and the committee is made up of management and union, and I totally agree with what Darlene is trying to do, but she has like 30 employees, and I don't know, for the record, I really would appreciate a copy of the list that you have.
I certainly can give that. And as far as the committee, there is no committee. I've brought that forward in the past is, I wanted to do the reviews, and there is no committee. There is no committee. But I've been an advocate since day one. You all know, I think Commissioner Romero, you remember, I put together a plan for the assessor's office, and that got denied, and then the county hired and paid someone lots of money to do it. And but nonetheless, I have always fought for the employees, but this is merit.
Okay. Mr. Archuleta.
Mr. Chairman, Commissioners, I guess, as usual, the buck stops here. I guess, first of all, this letter actually came to me on the 24th. As you guys know, I was out on vacation last week, so I have not even had the opportunity to speak to Mr. Cordova or anybody about this. There's different dynamics that we have to look at whenever you're looking at a raise as to where our staff, as far as midpoint, will this take them above midpoint? Does that have to go to the commission? Are they still within their ranges? Those kind of things, and then obviously take the budget into consideration. The attorney also just reminded me that this isn't on the agenda, so it can be a decision item today. I think it's more of an informational item that could come in front of the commission. And as we're trying to move forward and look at this, Ms. Parras is correct that we are in the middle of union negotiations. I believe we have them set for tomorrow. I see Chris in the back. He already made it into town, so I guess they're going to strategize tonight. And I just, for the record, I think I want to express to the Taos County staff and would be willing to even say this to the staff as a whole, is that the administration is not against raises. I mean, my whole mantra on some level is to make sure that Taos County employees are taking a paycheck home every 2 weeks, that Taos County employees are satisfied, we have a family-friendly environment, and that we're moving forward within Taos County. And I applaud the elected officials, the department heads, because every day they come in my office asking for raises, and unfortunately I have to say no, or I have to say we'll look into it, or I'll have to say maybe, because we have to take everybody into consideration when we're doing this and looking at this. And so we've come from about a $2.4 million deficit this year. We have an opportunity to have a balanced budget in Taos County in the next year, as the finance and manager just pushed out to the commission, is that we're in a transition time on some level. We did not put PILT in there this year. We can't look at PILT as a funding source for raises for next year unless it becomes a permanent fund for at the federal level. And so even though we may have a little bit extra money next year and we should be balanced, we still couldn't look at PILT in that aspect because it's not a recurring fund, and until the federal government does that, we have to continue using it as a year-to-year basis for that. And so we will look at this. I know that the Treasurer's Office has come forward, the Finance Office has come forward, I mean, Public Works and everybody, and we're trying to make sure that we look at this across the board. But at this point, we are in union negotiations, and as part of that contract, and second of all, it's not an agenda item, and so we will look at bringing that at a future agenda for you.
Okay. If I could just end this by passing one more last thing. I did look at who went over the midpoint. Just for information, I know you can't make a decision today. We're certainly going to come back and further discuss this, but let me, please, Hannes.
Okay. make sure the clerk receives a copy as well.
And so what you have in front of you is, once again, just an additional piece to what I first presented, and that is everyone's pay grade, title, and minimum, midpoint, and max. And I have an X next to those that are past the midpoint or will be past the midpoint if this was approved. And that's, once again, just for future, and we'll see you on the next round. Thank you.
Okay, thank you.
Just one quick question.
Come forward, Becky.
I just want a copy of that paper for our union. When it involves the bargaining unit, we're required to get a copy of that paper. Of whatever you have there.
Okay, so we'll move on to the next item. Actually, Leandro, you are requiring approval?
Yes, now I'll go ahead and ask the commission to look at DFA Resolution Number 4, which is the final adoption of the fiscal year 15 final budget.
Okay, commissioners?
I'll move to approve.
Okay.
Second.
Madam Clerk?
Yes.
Yes.
Yes, thank you very much.
Thank you.
To you and the staff and Lupe and everyone else that's
Yes, I'd
involved.
like to thank Lupe Martinez again publicly. She puts tons of work into this budget. The presentations that you guys see, she really works very hard for the county, so.
Thank you very much. We still have one item.
If we could adjourn and then go ahead and go into the special meeting.
Okay, very good. So motion to adjourn, is there a second?
Second.
Okay, Madam Clerk?
Yes.
Yes.